in 2000s when we were there. Anything? Am I still audible, right? Can somebody confirm, please?
Sir, you're audible, sir.
Okay, all right. All right. So, having kept this traditional conventional autopsy on one side, let's see what if there was a more technology enabled solution for autopsy. So, we developed this solution. Of course, I'm not going to be talking about my company's product. I'm only going to be talking about the technology, though I might show the software which belongs to my company, because this is an educational conference and I would not be doing any marketing at all. So this was a photo taken from St. John's Medical College mortuary, where we had done the proof of concept around 3 years before. And this is what I'm going to share, and not just share the virtual autopsy and stop, how a couple of cases wherein the crime scene and findings of the body was solved by the virtual autopsy. So going ahead, so what it is, firstly, you need to have clear kind of a definition. What is virtual autopsy? It's a forensic procedure conducted by a forensic medicine expert or a forensic pathologist, what they call here in Malaysia or UK or Philippines or in the ASEAN region. So it's not radiology. People should not think it's postmortem done by CT scanner. No, postmortem done by CT scanner. CT is a radiology one. We would use CT to generate some image, generated data, but it's different. So let's go ahead. How is it done? It will be done on a digital three-dimensional body. The data and the images are obtained from a whole body scan. The whole body scan can be a multi-slice CT, can be MRI, can be anything. And why is it done? The question is whether in our personal lives or in our professional lives, why are we doing this? We are doing this to empower and enable the forensic doctors, the forensic team, it could be forensic scientists, to work more efficiently and support the better justice in the society, in the medical legal system. And for whom are we doing? We are doing this to give dignity to the diseased body. We want to treat the body with more respect. Whenever somebody passed away, what do we message? We all message RIP, right? Rest in peace. When the body, an unnatural death undergoes so much of invasive autopsy, an entire eye incision, opening the skull, taking out the skull and taking out the layers of the brain, take out the brain and the base of the skull just to look at fractures. But in our virtual autopsy, body remains in a body bag. We just do a whole body scan in 2 minutes. Take my words, I'm not exaggerating, 2 minutes. And the data that comes out in the next 5 to 7 minutes is made into 3D, and body truly rest in peace on the mortuary table, while all analysis can happen on the medical grade monitor by the forensic doctor and the forensic scientist. In fact, in our team, we have forensic scientists who have been trained in virtual autopsy, who are helping with the thing, because they have the basic anatomy and the forensic medicine knowledge for them to be helping us out. So keep this in mind. This is a body in a body bag kept on a CT scanner, and different from the living people scanning, we have a different kind of scanning protocol. And then the scanning from the top of the head to the bottom of the feet, we call it as head first and a supine position, finishes in 2 minutes. And what comes out is actually called as DICOM slices. You must have seen any of your parents, friends, relatives, that this is what a CT scanner gives out: black and white and gray images and two-dimensional images. We are not talking of this. So please remember, after this virtual autopsy, that we use this data and create a 3D out of it. And not just 3D, it's not a animation, it's not Mickey Mouse, Donald Duck. I mean, those are my times cartoons. Maybe I don't know what we have now, Chota Beam or whatever Ninja. We are not talking of that. We are doing a reconstruct, because if you see an animated cartoon, when you cut it, inside is all black. They are not mapping everything. Here we are going to map every voxel. We don't say pixel, because each one will have at least a 0.5 millimeter z-axis. So there's an x-axis, there's a y-axis, and there's going to be a small z-axis. So compared to pixel, which only has a length and breadth, so we call it as voxel. Every voxel in the data gets reconstructed, and then our software will check the density, whether it is bone or air or metal or bullet or blood or water. And then, so when we are able to dissect out the body, we go till the last half a millimeter, we will be able to see that. So within this 1 hour, it will be difficult to give a demo of that, but I'll just give few visuals in the next 5 to 7 minutes. And then I will show a few cases that we have handled wherein this collaboration between the crime scene done mostly by the forensic scientist and the postmortem findings, how it could be integrated for solving problems. So this is how a body on the software looks like. It's a 3D body. In the end, if I get 10 minutes extra, I will show an actual live demo. That will be what you will walk away with. But these are screenshots from our software, which call it as 4D biopsy. When we dissect out, skin can come out. When we dissect out further, muscle can come out. See, did you see? We just use like a digital scalpel using a mouse, and we are just cutting. So instead of making that eye incision, we just cut. And you can see, if you see the thigh muscles, even the thin strap muscles, what I call sartorius and all, are clearly seen. And when you cut further, you can go to the bone, you can see the kidneys, you can see the heart. This is just at a high level. You can actually go at a millimeter by millimeter. You can make measurements. You can take angles. You can check for density of the tissue. You can mark out area. And there's also something called a FORDS, FORDS. This is not a Ford car. A Ford is of course, is an American car. This Ford is Forensic Decision Support System. It's FORDS, FOR standing for forensic. So based on that, we will analyze. And in case that body didn't have a head and neck, I'm just trying to show the head and neck skin, take out the skin muscle, take out the muscle bone, and you can even look at the small holes in the mandible, which is basically for the nutrient artery of the mandible, of the bone, because even bone needs nutrition. So even that small holes are all tracked, and you can, and it will be 3D. You can rotate up, down, left, right, and then go, which I'll try to show towards the end. You can like see, you can now looking at from the right hand side, and you could look at the clarity of the vertebra. If you note classical autopsy, we never try to look at the vertebral injuries because already 1.5 hours we take for incising the front, and we cannot be like putting the body upside down with the back up, and we can't start dissecting the back. While here, with just one scan, the entire body can be virtually or digitally dissected and then correlated for stab wound, bullet track, diseases, injuries, and even mass disasters for identification. Teeth, forensic odontology can be done. If any of you would work with the forensic odontology, if not, how would you count the teeth? If you have seen, right, for unknown bodies, from here, from the angle of the mouth, if you visualize, if you're not seeing me, we go up to the ear, both left side, right side, because there's rigor mortis. Our cases cannot say open the mouth and I count the teeth. So we have to break that rigor mortis, then look for the teeth. No need for all the such invasive thing to be done. We just click, all the data from the skin to the teeth is captured. We go on dissecting, choose the data which we want, analyze, record in our workflow management system to generate a virtual autopsy report, which will be in line with the postmortem report. Okay, this is the base of the skull. If you remember the base of the skull, and this dissection alone takes half an hour. And when I show this to forensic doctor, they say if you can do this in like 2-3 clicks, they say that this alone would save us half an hour of dissection, because you have to take out the scalp first, and then you have to reflect the scalp. Use maybe Scotland Yard uses electric saw, Victoria Hospital will use a manual saw. That's the difference. And then the skull has to go. Then the coverings of the brain, the dura mater, arachnoid matter, pia mater, all the meninges has to go. Brain has to be dissected. Then the base of the skull will also dura. Then you strip that. So entire thing here can be done in 3 mouse click. Remind me if I don't show this before we finish the call, because I know we'll be constrained by time. And if you just look at this, look at the nose part. If you can see my mouse, there is the soft tissue of the nose. There is the cartilage of the nose. And then there is the bony part of the nose. So if there is any weapon that has cut through this, let's say only the soft tissue is cut, what will I help the investigating officer? I will say that it is a light cutting weapon, maybe a blade or a paper knife, because it just cut the very superficial. Let's say it has cut the cartilage also. That means the incised wound has cut the soft tissue and the cartilage. I will say maybe a medium cutting, like a kitchen knife. those kind of things, or a Rambo knife, right? Or the Gurkha knife, what we call the Nepalis. And the last one, let's say wounds here, the has gone through the nasal bone. So what will we say? We are going to say that the weapon that has caused the injuries is like a heavy weapon, heavy cutting weapon, like sickle or like a machete, right? What they call. So that will be there. So it is not just about visualizing virtual autopsy, very nice images. It is about how relevant and how helpful it will be for the investigation procedures. And there will be a workflow integrated management system to maintain chain of custody, confidentiality, integrity, authenticity, because in the court of law, it should be acceptable as an evidence. So we have an entire workflow integrated management system, which starts from body management on request getting from investigation officer or the magistrate, becomes the case management, smart external examination. Of course, the internal is not opening. Internal is all done digitally. If required, small amount of tissue can be done, because the Royal College of Forensic Pathology says that we will just make a 2 to 3 inch incision. It's still considered a minimal invasive autopsy, and the tissue can be sent for histopathology, toxicology, and microbiology, whatever is based on the particular case, and end up with a report. So that's how it is. So if it is clear till here, I can go to a couple of cases that how virtual autopsy. So we finished the virtual autopsy part, how it will be correlated with CSI or the crime scene investigation evidence, to link the internal findings in the body with the external evidence. So it could be as simple as a knife or a bullet or a screwdriver. We had one case of a stab wound. Virtual autopsy, we showed that the stab wound track had gone up to the lumbar vertebra, anterior surface of the, imagine the lumbar vertebra body, how deep it would have gone, and it had caused a nick there. So when we told this to the police, they're thinking, how can it go? A knife cannot be so long. Then eventually it turned out to be like a screwdriver, a long screwdriver, which was through which it had stabbed. So this is how we can tell based on the injury pattern what could be the weapon. Not just like that. I mean, I hope there are no police officers sitting there. Most of the times they will get 4 or 5 weapons and they say, sir, just adjust. You think which weapon could have caused the stab wounds? Because the actual stab wound weapon may not be traced. It doesn't happen always, but once in a while that happens. So that objectivity will be not there. And by having this virtual autopsy, we take away the subjective analysis, we take away our personal opinion and make it more objective. First case, let's say there's a blunt, not let's say, this was this blunt force trauma. There are these linear skull fractures I was showing like from the base of the skull, which was not seen initially while the 3D showed. Even they opened up the body, they did not see. And they were wondering what was the cause of death. There was some bleeding. So it was actually like a hammer hit, but it was hit somewhere at the back, and only the base of the skull had fracture. And you know, when person is hit in the back, there is no nose bleeding, no ear bleeding, because the pressure in the posterior aspect only will cause a boggy swelling. There's no space for the cranial blood to come out. So this, by matching the weapon and showing the such thin linear fracture, you'll not believe, just like a hairline fracture that had happened, it helped confirm the assailant's role. Okay. And also this back one, he also hit on this back, right? This compressed fracture. I was again telling classical autopsy, we don't do the vertebral dissection. You see this? This is a T12 vertebra, which has the rib. You can clearly see the rib. Then it is the L1, L2. L2 looks normal. Only the L1. Actually, this person was trying to escape and he had jumped and he like landed on the feet before, like when the assault. And then there was this compressed fracture that happened. And this would have been clearly missed out of that L1 compressed fracture has taken place if we had not opened using classical autopsy, or not opened vertebrae. Even if vertebrae opened from behind, we can't be like completely disarticulating the body, right? There are family members waiting outside. Within an hour, we have to give, or 1 to 2 hours we have to give. So this is the capability of virtual autopsy, that you can literally dissect out one vertebra by doing a dissection and then see it anteriorly, superiorly, left, right, and analyze each vertebra as if the vertebra has been taken out from the body and kept in the examination tray. So this is also useful for all those anthropology, like forensic anthropologists, few of you ever go after finishing MSc forensic science. In forensic anthropology, imagine when you get bones, right? What do? You will be boiling. They'll be boiling with soda so that the soft tissue goes. Then only the bone is clean, and then they take the bone, put it on the osteometric board, take the measurements, right? Length, breadth, and all the index, cephalics index, and all that calculated. Here, no need to do. Let the body, the bony part or the skeletal remains remain. You just scan it and you just keep it aside. Do all the analysis of the anthropology or the mass disaster on the medical grade and high performance computing monitor. Second case was this gunshot wound, wherein the trajectory is always a problem. We normally in classical autopsy will use like a blunt probe, trying to see where the angle went. Is it inside, upwards, and are downwards, are left to right, are behind, front to back, all three axes we get confused. In this case, whenever the trajectory is seen, the body is still in the body bag. So if the court, when I'm asked in the witness box, are you sure of it that it was not caused? I said, no blunt probe was used, no false tracks were created, and that will strengthen the shooting distance, the angle, and the investigating officers and the prosecution case, ensuring, if not, our conviction rates in most countries, including India, is in single digit, right? By using technology, the conviction rate will go up. So the victim and the family members will get justice, and we would be, as a forensic people, will be having more satisfaction in doing the job done. Now you must be wondering that why Dr. Pramod only showing all text, where are the cases? Here the cases will come. See, in drowning or strangulation, always this question, whether the person was strangulated, thrown into the lake, like is it a post-mortem drowning or an ante-mortem drowning? And many times it will be no like water in the lungs and all. But we can even go to a small extent of analysis, some foreign particles like a grass or a weed that would have gone. And in this particular case, we could differentiate and tell this particular case, because we can even see the hyoid bone. You imagine, this is not a Photoshop thing. It is a dissection of hyoid bone, like without touching. Normally, what happens when hyoid bone fracture, we get questioned, is it antemortem, postmortem? Unlike other bones, hyoid could be a cartilage below 40 years. So there will be not much of blood extravasation to say it is antemortem injury. But in this case, decomposed body or fresh body taken out from the pond, we can see the hyoid bone, look for whether fracture is there, inward, outward, like, and then come to a conclusion that what kind of cause of death and manner of death will be there. So child abuse detection, this I'll show some images. One is when a child is abused, like what we call battered baby. There's a lot of investigation from the psychologist to the child care person, and injuries would be there or not. So in this case, when we do 3D virtual autopsy, we can look at the various injuries and try to have the age of the injuries, and so that the abuser, the child abuser, can be convicted. So you see this here now. What is a case is, it's actually of a big one. I'll show the child one, and it has been sliced at the eyeball level, like a slice. And you could see the cornea, you could see the little space behind, we call it anterior chamber, the lens and everything. So if a child has been abused or like pushed and the head hit there, what happens in classical autopsy? The cornea is already clouded, right? After death, the cornea is clouded. You can't see inside. Can we say that, oh, I want to take out the eyeball of the baby and then see? No, it will be so already that the parents or the caretaker would be so sad because the child, due to constant abuse, has died. So in this case, the child's body, baby's body remains rest in peace. We can do the dissection. Let's say the lens is subluxated. Let's say the retrobulbar. See, this is a cut from the top. You can see how beautiful the eyeball and the optic nerve. In this case, there was no bleeding, retrobulbar region. That's what I'm saying. So if there is a bleeding in the retrobulbar region, that means it was punched in the eyeball, or it was shaken violently or whatever. So that will give us evidence without even like doing any kind of invasive surgery. Even in classical autopsy, if you open, it's most difficult to demonstrate anything in the eyeball and in the retrobulbar region. So it's very helpful in child abuse or battered baby cases. Mass disasters, as we know, of course, we had this Kumbh Mela in Indonesian police. When I presented, they were They were actually very happy to know this identification, that it can be done, odontology can be done. And they said that this alone feature is enough for them to implement virtual autopsy, because we can quickly do 2-minute scanning and then we can do. So let's say this was, okay, this was 20 years before. If those of you who remember the 2005 tsunami, I think even Philippines, Indonesia, India was hit. I was part of the rescue team in India, did not go as a forensic expert. So in this case, let's say we are scanning 100 cases come and we go on scanning 2 minutes, and then we find a stab wound of one of the case out of the 100. So what will that happen? That means somebody did a foul play. They knew that so many people died in the tsunami or in earthquake or in whatever, in stampede. But then just to have a revenge, maybe he just stabbed me and then threw my body along with the other mass disaster victims. Now, what will happen routinely? Routinely, they might just do extra examination, go off. It might be missed. So we can quickly doing can actually prevent the injustice to the person who has actually not a victim of mass disaster, but of a foul play, but shielded or whatever it is done into the other bodies. So this was one orphanage, a landslide case which we did. Orphanage got damaged by the wall falling due to constant rain. And around 16 cases, we all finished doing the cases within like 3 to 4 hours in the night, because the government saying by morning the people will start complaining, opposition party will oppose, and that is where all the mud and all still is there. So this is the skin, this is the muscle, and when you go to the bone, you can see a pattern of fracture where the wall had fallen on the right hand side. That side, the children had all these injuries, compound comminuted fracture due to the pressure. You can also see the pelvic fracture here. Pelvic fracture had happened because normally pelvic fracture happens due to a very high impact. And we could also do this odontology because people said orphanage had even adult people, not children, and all that. So these were some of the cases. And all this, you just have to imagine or visualize body is just in a body bag, scan, and then we go on dissecting. Skin, muscle, you can already see, we can actually show the bleeding here when we do a dissection. And then down below, you can see the thigh bone, fracture femur, left side. It was just below this part. Okay. This was the pelvic fracture. So that was about helpfulness in mass disaster. Road traffic accident, yes, we can do reconstruction, primary impact, secondary impact. Did another vehicle run over, or where was the person hit initially, to correlate, because many times a road traffic accident could be a homicide, right? And all that can be done, and we could clarify that in the court of law, give a better expert testimony and correlate the CSI findings with the virtual autopsy findings. Bomb blast victims. Yeah, okay. Hopefully there will be no bomb blast, but when it happens, I was talking of this forensic decision support system, how it can identify the bullets. Here is one case. Three friends did some looting of some wealth, and as usual, when they were sharing the loot, they had a fight, and two of the friends shot the third friend and went and buried. This is actually a Malaysian Indian person buried in a Chinese cemetery. So after 2 months, the police came to know, and the police got an exhumation order for magistrate. And if you see this, these are actual one Royal Malaysian Police. You see the body in 2 months was already skeletonized. So what they said, nothing to do post-mortem. They got a metal detector. Here, you can see here, these are the accused, two friends who had shot this third friend. And they just got a metal detector saying that allegedly shot 3 times. Let's take out the bullet and close back the body. No need to pick up the body and come to the hospital post-mortem. So this is what happened. So they could not find. That means in the end, in the exhumation side, they could not find. Come to the hospital UKM, which is the National University Malaysia Forensic Department. Professor Sharum was a HOD as the case. They tried to use a detector to find out bullets, could not find. So we did virtual autopsy. And when we did virtual autopsy, this failure to detect how technology helped, we did a technology and we have like a bullet detection. We just click. It's basically detecting the metal, not exactly the bullet. Maybe once AI comes in, it can tell if this metal is a bullet or not a metal. But if you see here, this is the zip of the body bag. If you see my mouse, hopefully you are seeing. And this is the teeth, which the software thought, because enamel is the hardest substance. So when we are filtering out the hard substance, equal to metal. Even the enamel got done. There is something in his like ear there here. This was the holster of the body where they keep the revolver and pistol. If you've seen old English movies, cowboy movies, he was a gangster. Those three were basically a gangster. And then that was there. And there's a zip of the body bag. I think all of you can identify the zip of the body, zip of his pant, not the body bag. The top one is a zip of the body bag. This is a zip of his pant. And there are three bullets, two bullets almost intact. Third was a deformed one. So we told the forensic doctor, here is your three bullets to pick up. They asked, and how come the metal detector? Actually, metal detector was doing beep, 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 beep out all the places of the body. It's like your airport, right? What happens sometimes there is some small coin or something in your shoe or some garment which has a metallic wiring. So you don't know, and the security chap will go on frisking. So when we did closer analysis, if you see here, when we did further like dissection, all dissection, you can see the old fracture in the femur. There is a healing there. There's actually a swelling still there, the bony swelling. And when we went in digitally, the body is just there. There was actually a rod put in his thigh bone. It was an old fracture. The orthopedic doctor who operated had put what we call an intramedullary nailing, what we normally call. So because of this rod and all other things, the whole body was only doing beep, beep, beep. The metal detector could not separate out the bullets, which we could do by virtual autopsy or using forensic decision support system. Also, like postmortem interval, it's always told. Of course, you cannot be having like CSI, right? Oh, this patient died between 2 p.m. and 2:20 p.m. We can never get that precise estimation. People go on asking me after seeing CSI serials. We can only give a range up to 6 hours, maybe 1 to 2 hours, 6 to 12 hours. But using the digital pathology, again, which is an add-on to the virtual autopsy as a complementary technology, we can refine this time of death estimate, which normally is done by rigor mortis, livor mortis, and the algar mortis, the temperature. Also, I was telling the same thing in some institutes in Switzerland and Victorian Institute of Forensic Medicine, Melbourne and all, for the soft tissues. This is a challenge because normally we use CT. Now for getting CT to forensic itself is a challenge. MRI is a bigger challenge, more costly, takes time. And if you ask, why don't we do MRI? Because our forensic cases will have some metallic thing, from a tooth filling to total hip replacement or knee replacement or a piece of a knife or a bullet or whatever. So we cannot do MRI because ferromagnetic substances is contraindicated. But if you have done CT and you find no injuries, no disease, but outside there is like smothering, like somebody, one of you put a pillow and smother, only the subconjunctival hemorrhage would be there. So there is no injuries here also there. So for the soft tissue injuries, wherein it could just be in the thin strap muscles, they are trying with an MRI scan to find out so that it cannot be passed away as a natural death. Okay, sudden unexplained death. This is one perhaps almost my last case. I will show the actual images. See what happens. Uh, what happens in Malaysia is these maids come from Indonesia to work. Okay, because that's what happens, right? Indonesia maids looking for a job. Our Philippines nurses go and work in the Middle East. Those kind of things. So, and what will happen is when maids come and come into Indonesia where they're getting the working permit, they undergo all chest X-ray and pregnancy testing, tuberculosis testing, and everything. And when something happens and she dies at in the Malaysian employer's house, then the fight between Indonesian government and Malaysian government. Indonesia government says our maids are getting abused. Malaysian people are doing that. And of course, not all bosses are bad. There are many bosses who take care. And now suddenly they have to answer. They have to tell the police. They want to defend. So in this particular case, sudden death of maid at an employer's house is always challenging. So obviously, police made an unnatural death report and it came for post-mortem. And there was no external injuries. Blood sample taken for toxicology was run for routine drugs instantaneously. There was no routine. 10 drugs was run. No drugs had come. Now they said before opening they wanted us to do digital autopsy. We did digital autopsy or virtual autopsy, whatever you call, no cut autopsy, and we find a fetal skeleton in her pelvis. These are little low resolution images that I'm sitting here and doing, but you can make out a fetal skeleton in the pelvis. So when they said no, her pregnancy test was negative, your software is showing some noise, what we call, right, software noise means like some shadows, this is not a fetal skeleton. They opened up, uterus was having almost 7 to 8 months baby, and they opened up the uterus, and here is the baby inside. So this was the classical autopsy done to confirm the virtual autopsy findings. Then we also said in the lungs, we call it a snowstorm effect, all this patch. We said it is miliary tuberculosis. Miliary tuberculosis means both the lungs had tuberculosis. And then they said, no, again, your software is showing something else. But when they opened up, cut the lungs, you can see all the miliary there here, white patch. This is not a normal lung. So what we told them is that this is how a normal lung should look. And this is how a miliary tuberculosis look. That's it. So there's no need to be opening, exposing the forensic staff, mortuary staff, doctor to all infected things. So virtual autopsy makes the working more occupational safe. Of course, COVID is over. We never know when an infected body comes. It need not be hepatitis B or HIV. It can be H5N1 or any new thing. So no need to be opening and then get the whole mortuary to be infected. So this advantage in infected bodies, sudden natural deaths, that we can get the cause of death, because in the crime scene, there was nothing. There was no fighting, no abusing, no blood stain, no broken things, no robbery attempt. So it was like the police came and said, sir, we really don't know what happened. She was just like sitting there, young lady, 35 years, because above 40 years or something in Indonesia, in Malaysia, they don't even keep eligible to be kept as a maid. I think 45, if I'm correct, if I remember correctly. Yeah. And even the culture done showed Mycobacterium tuberculosis done on the Lowenstein-Jensen culture media. So this was a few of the cases in my experience wherein virtual autopsy, of course, it's more virtual autopsy heavy, but correlating either no findings in crime scene or less findings or confusion in the crime scene, that it could help. So I think I finished 35 minutes. If somebody can say, is there a time for demo or only time for Q&A? Based on that, I can proceed.
Yes, sir, you still have time.
Okay, I have time, yeah. So I'll have to ask the audience, do you want to have question answer sessions? Talking about how it is more humanitarian, respecting some religious sentiments of doing a burial immediately on the same day, not keeping that body comes at Saturday evening, wait till Monday morning, and how it is like empathy to the bereaved family members, better for police, better for the judiciary. You want to have any question answer, or how forensic scientists can play a role, or you want to see a demo for 5 to 7 minutes? I'll leave it to the audience.
Sir, they want demo.
Okay, all right.
Yeah, sir.
Okay, I run a demo live software, this one. Let me just give to do the thing, and I'm going to. Can somebody confirm, can they see my screen?
Yes, sir.
Yeah, of a baby's head and neck skull, right? You can see, right? All
Yes,
right.
sir. Yes, sir.
Okay, thank you. So this baby, which is a road traffic accident, in fact, you can even see the pain, right? The pain which the baby had. So this is the 3D of the baby come out of that 2D data, black and white slice data. And please forgive apologies, because it's not on a medical grade monitor and I'm not sitting next to you. We are going through projector and whatever. So other than the color, you can focus on the findings. So this is a 3D, as I mentioned. So this is basically telling yes is superior, and then I is inferior and all. And what we can do is, now right, the body, baby's body after scan, rest in peace. You just have to visualize that. And I'm just using my digital scalpel, and you can just see I'm dissecting out the headband and everything goes, surgical bandage on the eye goes. I'm going to the skin level. I'm trying to do it slowly for you to appreciate. Then you can see the subcutaneous. And then finally, when I dissect out, I just want to see, I can go up to the bone level. So if I can see the bone level, you can see that the baby has already been operated. These are the round burr hole surgeries because they had done operated. It was a head injury, baby fallen from a two-wheeler, and then they operated to take out the blood. These are the 4 burr holes. These are the staples because bone, once it is cut, you cannot fix it, right? You put metallic staples. This is the metallic staples that cut to put back the operated piece of bone. The left cheek, if you can see, there is again a prosthesis put because the entire left face was crushed off of the baby. So this is what can be seen. Can you even imagine in traditional autopsy that I can, like a goat or something, take out the skin of the baby to look at the various injuries? Impossible, right? And now I was talking of the base of the skull, right? I'm just trying to show in a very like a 3-minute trailer of a 3-hour movie. So I want to see internally base of the skull. So what I use is I use a dissection. And as I mentioned, right, I would show with 3 clicks that I can just click. I can go to the base of the skull, and there you can see the base of the skull. This is the nose end at the bottom of your screen, anterior cranial fossa, middle cranial fossa, and the posterior cranial fossa with the big hole, which is the foramen magnum. So that there is no fracture here. So that is, and even the small hole at foramen rotundum, everything can be seen, can be zoomed in, zoomed out. You can do even measurements. Let's say there's a measurement I want to do. How much is this hole? Because it can be measured as accurate in the sub-millimeter, 22.3 millimeter. And whether you zoom in and zoom out, it will be the actual baby's measurement. It doesn't alter because when the baby is kept on the CT scan table, the CT would have taken a scout film with the actual physical measurement. Our software will take that parameter and it will do the scaling or the zooming in. So when we show whether you are zoomed in 2x or 0.5x, the measurement will still be the same accurate based on the thing. Of course, I would say 95% accurate. I'll never claim 100% accurate, but it's going to be as accurate for measuring or measurement of angles and various other things. So in this case, you wanted to see that eyeball, right? So let me just cut further into the orbit here. And because I have taken out everything, right, I need to get the soft tissue. So I just go back and click on the soft tissue. Okay, maybe I cut a little more perhaps. So I come back to the eyeball level. So if you see the eyeball level, okay, let me do. If you are seeing the baby's right side, you can see the eyeball, right? And I'll have to do a further dissection to make it sure. Okay, you can see the eyeball and the optic now. It's not very clear for you. And if you see the left side, do you see any eyeball here? There is no eyeball here because, as you know, right, the baby's left side eyeball, the whole cheek was operated, and then it was actually operated, and along with that, the eyeball was removed because the eyeball was crushed. So as what I wanted to show is basically to say that we could, and there is also, if you want to see this thing, sir, so this is not clear. We have something called a cross-sectional imaging, or what here CSI is not crime scene imaging. Here CSI, our CSI is cross-sectional imaging because it's virtual autopsy. And you can see now, I can go millimeter by millimeter. So you are seeing actually from the top, yeah, not from the bottom. So your right hand side is the left of the baby here. Here is the optic now. Here's the orbital thing. You can see the cornea. So you can go millimeter from the top to the bottom and not miss out on a single findings. While here, if you see right on the left hand side, there's no eyeball. And these are the bleeding here. And how do you make out the bleeding? Here, if you see the density, I click on the sinus. What does it come here? -1000 air. I click on the bone. You see 1721 bone. There's something called the density tissue density. The biomedical engineer Hounsfield has done. It's also called as Hounsfield unit. And you can make out if it is a soft tissue, it will show soft tissue. And if it is going to be a metal, there it is going to show the metal. So this will go on helping for us wherever it is going to be there. And not only that, I want to see what all is there inside, right? Because I don't understand. I'm not a radiologist. I'm a forensic doctor. So we can have this mean calculation. So I can just go back here and then mark it here just to understand what is inside this. And when I leave it here, you can see the entire analysis. I hope you can see the screen, right? The entire analysis of minus 1000 to 1617, air is 42%, bone is there, fat 8%, and soft tissue. So this is basically to map whatever is there in order for us to know, is there a metal, is there a soft tissue, is there anything? And let's say bullet track is there, you want to measure the angle. As I was saying that, it will also be even possible to measure the angle. So let's say this, it has come here, and then it has gone like this. So you can see this angle, 73.3 degree. So if it has hit here and then ricocheted, many times if you know ballistics, right, bullet comes from inside, hits on the bony wall, then goes back. All the what angle, 55.5 degrees. So all these measurements and everything, all that can be done. Okay. And you want to put the findings, it's very easy. This is an entire analytics. We actually do a 3-day workshop, taking of findings, taking of video, taking of everything that can be done. Everything is all done here only. I just want to show here, eyeball is intact. I can just type here, eyeball is intact here. And then the other one is eyeball missing here. So let's say somebody has donated eyeball, and we can document that really both eyeballs were taken, and during post-mortem is not there. Eyeball missing. It's a little small font for you, but I think here you can see eyeball missing, hopefully. So going back to the 3D, the one which mass disaster forensic odontology, the one which Indonesian Interpol officers liked it, right? I just want to show that. If I'll try to show this, possible. I just reset the whole thing. Yes. And then, so we have something called a dental identification, right? I use that. What it will does is it will just hide off all the thing. It will just hide off all the thing, and then only this remains. One click and only the metallic portion remains, like what I said. So teeth, not just the crown. How much is the thing? Is there a filling? Because all these burns victim, crash victims, normally it will be based on the teeth. No need to be taking permanent record. Second opinion can be taken. It's not just about taking an X-ray. It's getting the entire 2D data into 3D for us to zoom in, zoom out, do measurements. Whether it's a child, teeth erupted, teeth missing, teeth broken, all that can be seen by a single click of a button, and the entire forensic odontology. See, even in a child, even though it's a small child, could still make out the hyoid bone. And we could actually just cut off this hyoid bone and then carry out an analysis. So that was my brief demo, what I wanted to show. Yeah. If there any question, I'll handle, or there is just some more part of my presentation. Yeah. So if you allow me to continue, we finished the demo and we have implemented global standards, ICD level, International Classification of Disease. Even the living hospital information system are still in ICD-10, but integrated ICD-11, BNSS, that is the Indian Bharatiya Nyaya Samhita, those who are not from India. It was the initial IPC, which is the Indian Penal Code, and CRPC. That has been implemented. Disaster victim identification, if you remember the pink form and the yellow form for antemortem, postmortem findings. Pink is the postmortem findings. All that one, including the codes, has been done. So whatever language in 200 countries, wherever Interpol is presence is there, the report that is going to go for this mass disaster, because we could have foreigners inside that mass disaster, will be based on this DVI standards. So with that, as a good presenter, I think it's showing 47 minutes on my watch. I'll leave the last 10 minutes for Q&A. Meanwhile, when you're asking questions, I'll have these takeaway points done. No-cut autopsy or virtual autopsy is a forensic procedure. It's forensic, not radiology. Please remember, conducted by a forensic medicine expert. And with forensic specific software, you cannot have a clinical radiology you're trying to do when somebody says a CT is the same. Of course, for us, any CT will do. Any manufacturer, anywhere, we are not tied up to one thing. We want to be very open, vendor neutral. You get China made CT scanner. Of course, with due respect to the Chinese thing, not that they are bad quality. GE Healthcare, Philips, Toshiba, Fujitsu, whatever, Hitachi, anything from US to Japan, anything we will do. We only need the 2D data from that. And why is this done? Obviously, to make the forensic medicine expert, correlate the findings of crime scene, internal one, trace evidence, and help the social justice system. Do our part. Okay. So that's our company here in India. Those of you, if you ever want to do internship or if at all we have job one, you can free to please apply. And yeah, before the thank you, I'll give this 10 minutes for Q&A. Over to you, the organizing committee, please.
Thank you, sir. Delegates, if you have any questions, you can raise your hand. We'll pass the microphones to you. And the online participants, you can post your questions in the chat box.
Thank you very much for that instructions. I appreciate it.
So if like in India there are many poisoning cases, so is there any advancement to see toxicological, like for toxicological analysis we'll need to cut the body, right? So is there any advancement to see that what poison is present?
Okay, so if I understand and I repeat, thank you for the question, is that how toxicology can be done in virtual autopsy? You are saying that the body has to be cut. So if you ask a WHO expert, the one in Dr. Pillai sir, who is my senior in Cochin Amrita Institute, it's a WHO accredited clinical and forensic toxicology lab. A blood sample in 90% of the cases can solve the toxicology one. There's no need for contents of stomach, portion of the liver, portion of the kidney, because the thin layer chromatography with forensic science labs is all getting shifted as HPLC, GCMS, high performance liquid chromatography and gas chromatography. You only need, so the body, once we do external examination, our standard operating procedure, we take out the blood from the femoral vein. You don't have to cut open the body. So that can solve the toxicology. So it has to still go to the forensic lab, but a blood sample is enough, unless it is you will say that, okay, sir, he just died in half an hour. It may not have gone into the blood. There are various things. People just put a feeding tube into the stomach and take out the contents of the stomach and match it with the bottle that is present at the crime scene, because you want to do a matching, because blood would have already metabolized, right? So you don't have to cut the body. And the last one is, the R&D is happening using an MR spectroscopy. So MR spectroscopy, what will it do? It will give peaks and waves based on the poison. So if it is organophosphorus insecticide something, organochlorine something, if it is going to be barbiturate something, diazepam, but that's still there, but that's in the pipeline. So one day virtual autopsy, even for poisoning cases. See, in forensic, person dies due to 3 reasons only. One is, it could be injuries. Virtual autopsy can show all injuries. Second, it can be disease. It can tell all disease. The only challenge what can happen is, you will see a lung shadow, but now I'm not too sure, is that lung shadow an infection or is it a tumor? So what we have to do, instead of opening out the entire lungs between the ribs, I just put a biopsy, a thick biopsy needle. It's called like a crocodile forceps. I just take out one punch biopsy of that shadow, because in virtual autopsy, I can see it is in right lung, it is in upper lobe, it is lower lobe. We only have to make one small incision, put one crocodile forceps, and then true cut needle, and then just take it out. And half of it sent to microbiology, look for infection. Half will go to histopathology. So even in that case, when the body is taken out for washing or for burial or for cremation, there would not be any kinds of any incision, and the family members will be happy. That normally they will request, sir, please don't cut too much, cut less. We have to carry it to 500 kilometer, 1000 kilometer in bus and car and train and flight and all that. So of course that is a humanitarian one, but scientifically you want the tissue only. So the tissue can be taken out and sent. And if it is like chronic poisoning and all, even the tissue can be sent for toxicology by minimal invasive. So that's my answer. I hope I have answered your question.
Yes, sir.
Good morning, sir.
I would like to understand how through virtual autopsy can we take out like stomach contents, because in some cases it's very relevant about like how do we do it without cutting.
Yeah. So as I mentioned, like the Ryle's tube is put into the stomach for feeding for people in ICU, in unconscious patients, right? So the same Ryle's tube, when we put it back, and the Ryle's tube at the end will have one metallic thing to track to say that your tip of the end of the Ryle's tube, or what we call a nasogastric tube, is inside the stomach. That confirmation can be done based on the virtual autopsy. So if you're talking of a poisoning case, put the Ryle's tube, then scan the body. Now you can prove to the court of law, prove yourself that the tip of the Ryle's tube is inside, not into lungs or anywhere else. It is inside the stomach, and then use a 20 ml syringe, and you can aspirate all the content of the stomach for toxicology purposes.
Okay,
You
thank
don't
you.
have to take out the stomach, miss.
Okay, sir. Thank you, sir.
Yeah.
Good morning, sir. Sir, I have
Yes,
a
please.
similar question. In poisoning cases, it's seen that the stomach has charring kind of thing, especially arsenic kind of poisons. They do this burning effect in the stomach. So can that be identified with this virtual autopsy? And one more thing is that, sir, this is basically a CT scanning. So we have the standard CT scanning of a healthy human being already in our database. So can we compare both the suspected and the standard one? And like, is there some kind of software which automatically tells us that, okay, there is defect in this certain place?
Okay. So two questions you have asked. Thank you. Thank you for asking the question. First question is, you're talking about the inner lining of the stomach. Actually, I would have showed, if you ever come, I would have showed a demo. You can, in that case of pregnancy, we could even see the vesicouterine pouch, one small pouch between the bladder and the uterus. Even that can be seen. So because we are doing it at a millimeter. So the inner lining of the stomach, yes, you can say that there has been erosion, but it will not be possible. So what other forensic experts are doing is, they are trying to do like an endoscopy. Of course, you need to have that, like how you see the living person inside the stomach. Is there an ulcer? Is there anything? Same, you put the tube and look it into the video. Again, that is an add-on to the virtual autopsy. Virtual autopsy doesn't mean just CT. Something like CT, we are only saying it can be MRI, it can be endoscopy, it can be anything. So we can clearly see in the inside of the stomach videographically with a light, what you say like corrosive poisonings or alkali poisonings like sodium hydroxide and all, which cause corrosion or which cause all the changes in the stomach. That can be seen. No need to open the stomach invasively. That is the first question. Second question you asked was the antemortem and postmortem. Yes, our own software has a double window. Let's say somebody is having a head and neck CT done 3 years before for some headache there, and now unfortunately this person died in a helicopter crash. Now they want to identify. So we have done a virtual autopsy. So if the police or the investigation officer can get us that DICOM data, we can actually do. The 3D may not be clear because in living people, due to the radiation, they take 5 millimeter blocks. We take 0.5. You imagine we are getting 10x of that data. That is why our 3D is much more clear than what is done for living, because for living the calculation of the dose and all is a problem. We cannot be putting too much radiation. But in our cases, of course, the person is passed away. We can afford to have more milliamperage, more kilovoltage of current in that radiation tube for it to give more better clarity. Yes, we can do that matching of this known person's identified CT and the 3D, and we can say this person is identified or not identified specifically. It could be tooth filling, it could be something in the skull, or it can be the shape and the sinus shape, right? Many of your forensic scientists or forensic anthropologists have done the shape of the frontal sinus. That identification can be done if there is no fingerprint and all. Yes, that can be done, sir.
Okay, sir, thank you.
Welcome. That's good. You people are hearing. I thought because of my Zoom, you people had slept off. You asked good questions, means you were all awake and listening to me. Any more question? One more question I can take. It's 3 more minutes in my watch.
Hello, sir. Sir, my
Yes,
question
ma'am.
was related to how virtual autopsy would be helpful in drowning cases, like death due to drowning.
Okay. Yeah. Okay. So drowning, we know, can be accidental drowning, suicidal drowning, homicidal drowning, and various other things. And drowning, even in classical autopsy, is a challenging thing. Textbook, of course, talks of diatoms, test and everything, never done routinely. That's another matter. So the main question in most of the drowning, by the time body comes out, is like a decomposed or partially decomposed body. So if we are able to demonstrate any other injuries which are not consistent with accidental drowning, that means I literally have an invert fracture of the hyoid. That means I was throttled before thrown into the lake, or I was kicked in the abdomen, broken bone. That won't happen, because if it is a lake, it's not a flowing river. Yes, somebody drowned in flowing river can hit against the stone, can have fractures and all. But if it is a lake, we don't expect the water could have caused such internal fractures, multiple and all. So my answer is not simple. It's a very good question. It goes on case by case. Internal traumatic findings not consistent with accidental drowning or suicidal drowning will go in favor of what we call a homicidal kind of thing. And the other thing, any antemortem finding, somebody has been stabbed and then thrown, and there is a laceration in the liver, kicked in the liver, there are multiple laceration, and then so those kind of traumatic findings would help us to differentiate that. And the most important question, what you are saying is like a dry drowning, no lungs, no water in the lungs, even diatom won't go because the person moment he hits the lake and all. Those would be even challenging with virtual autopsy. I have to accept that even with virtual autopsy findings, it will be challenging of such atypical drowning cases. It's still a limitation. We are doing more R&D into that, trying to get that. Can we differentiate in much more accuracy? Yeah, that's a limitation, ma'am.
So you gave us about the advantages of virtual autopsy. Can you give us like another drawback where virtual autopsy will like we have to go for traditional autopsy?
Okay.
Any drawback?
Okay. So no drawback as such, I would say. But people do ask, sir, how do you see rigor mortis in virtual autopsy? Rigor mortis doesn't need incision, right? You only have to wear a gloved hand and see whether rigor mortis is there. Let's say liver mortis. See what we learn in forensic. Liver mortis, pink color, discoloration, cherry red, cyanide poisoning, and various kind of the thing, right? Liver mortis. There actually, if you remember, liver mortis can be inside also. So let's say a person has hanged, and then after that they're taken out, a person has been killed and person has died like this, and later just to simulate suicidal hanging, they were hanged. So the liver mortis inside out, if the body has stayed on the ground for 6 hours, virtual autopsy can internally see liver mortis to say that body has been moved from the crime scene, because the liver mortis is inside, is in the posterior aspect. The other limitation is, let's say heart attack, fresh heart attack, 30-year-old, no heart disease, and only the left anterior descending, one coronary artery, one small clot has gone. Virtual autopsy, the plain CT might miss out, so we might have to open up. So what people in UK, US, Australia are doing, they are doing something called is postmortem CT angiography. They take out the axillary artery here, put the catheter, inject the dye, and after seeing no injuries found in the body, no disease found in the body, but the crime scene says that he suddenly clutched his heart, he was playing badminton, or he was in the gym, he suddenly died, maybe something is in the heart. So such PMCT angiography can be done to see whether there is a clot in the coronary arteries, that the coronary artery disease caused death. So such limitations is about, as I mentioned, smothering. No injuries, just a soft pillow has been put on my head and I have been smothered. That will be difficult. So what will happen is, there is no residual radiation. People think we scan the whole body, we cannot touch the body. In cancer treatment, when we give radiation, there is radiation in the body. That's why if you see cancer patient, they said, don't touch the small babies, dispose the urine properly, because the radiation is still there. But in CT scan of whole body scan, the moment the button is off, the last slice is taken, there is zero radiation. So we can still come, either do a minimal invasive autopsy, or you as a forensic person says, no, I'm not happy with virtual autopsy, end up with 10 to 20% of the cases. This is the average standards told across the world, might undergo a full invasive classical autopsy.
Thank you,
in
sir.
such cases.
Thank you, sir.
Thank you, sir, for patiently answering all the questions. On behalf of ICAFS 2025, I extend our deepest gratitude to Dr. Major Pramod G. Bagli for delivering such an insightful and thought-provoking session on virtual autopsy and its forensic applications. Your expertise in forensic imaging, non-invasive autopsy techniques, and crime scene correlation has provided us with valuable perspectives on future of forensic pathology and its role in the justice system. We are truly grateful for your time and expertise. Thank you once again for gracing us with your presence and for your valuable contribution to this event. We look forward to more opportunities to learn from you in the future. Thank you, sir.
Thank you very much. Really appreciate the applause. I am honored. And for those of you who are celebrating, happy Holi, and may your life be always colorful, and God bless. Thank you once again to the organizing committee, and wish you all the best. And that's my contact number, my Indian Malaysian number with my email and my website. And you are free to reach out to me as a friend, as a senior friend. Thank you very much. And I log off.
With this, we conclude technical session 3 of ICAFS 2025. Our next section is on DNA technology for forensics, promoting justice in the 21st century by Dr. Ankit Srivatsava, Head School of Forensic Sciences at the West Bengal National University of Juridical Sciences. We will begin the technical session shortly after the high tea. A gentle reminder to the delegates, the poster presentation participants, I kindly request you to hand over the posters to our student volunteers. Delegates, please note, tea will be served in the staff pantry, first floor.
ಹಿಂದೆ ನಿಂತ ಲೈನ್ ಮಾಡಿದ್ರು ಅವ್ರಿಗೆ ನೋಡಿ
UJS, Kolkata. He also holds the position of Head, School of Forensic Sciences at the West Bengal National University of Judicial Sciences. With over 18 years of academic and research experience, Dr. Ankit has made significant contributions to the field of forensic genetics, DNA analysis, and forensic policy development. Throughout his career, he has authored numerous research articles and books published in renowned national and international journals. His expertise has earned him invitations for lectures and presentations in multiple countries, including United States of America, UK, China, Singapore, Thailand, the Netherlands, New Zealand, and Czech Republic. Dr. Ankit is also an editorial board member of several prestigious forensic journals and serves as a reviewer for internationally recognized scientific publications. He has played a pivotal role in organizing national and international forensic conferences and seminars, which have been funded by leading government bodies such as UGC, DST, and ICSSR. His contributions extend beyond academia. He has been instrumental in the development of forensic laboratories in academic institutions and has served as an external supervisor for Rutgers University, Camden, USA. As an active member of the American Academy of Forensic Sciences and the International Society for Forensic Genetics, Dr. Ankit continues to advance forensic science through interdisciplinary collaboration, research excellence, and forensic education reform. I now request Ms. Devi S., Assistant Professor, Department of Forensic Science at Kristu Jayanti College, to welcome Dr. Ankit with a plant sampling. It is indeed an honor to have such a distinguished expert with us today. Now, without further delay, I request Dr. Ankit to deliver his technical address.
Thank you, Mayank. So, good morning all. I'm sure you enjoyed the last day of the event. So, thank you for introducing me, Mayank, because to introduce the speaker, this is a formal culture of the conference, because that was started from 1950s, when Google or internet is not there, so that we can aware the public or the conference attendees to introduce. Now there is a Google, right? So I think from the next time we have to skip so that we can save the time, right? Whatever the attendees want, just type the Google and Google will inform you, definitely. The positive and negative, both the things. So this will be good. So to decide the topic and how and why I decided this one, definitely I will discuss. But don't be in tension. This is not technical. How, and I will not going to discuss what is the DNA, how this NGS, MPS, the basics of STR, there will be a confusing, how DNA is used in criminal justice system and what are the applications. I will discuss those with case analysis, right? What I observed in the past 20 years in the field of forensic, right? Something is blaming things, कि judiciary blames कि standards are not there, forensics blames कि judiciaries are not aware, and in this game the students or the whatever the faculty or the professionals of forensic field are suffering. So what we have to do, so first we will discuss the basics of all things, because no doubt it is my honor to be here in the Bengaluru, Karnataka. So I will start some cases related with the Karnataka. So Yeah. So, thanks to Don sir, the principal, Father George. However, I met with another principal also. So, Principal Father George, the whole faculties of the Department of Forensic Science and especially the students of the institute and the Kristu Jayanti College for inviting me to deliver the address on this topic. Because I am from Calcutta, so this is courtesy, to speak why Calcutta is good, because I am taking the salary from the institute from the in Calcutta. So Calcutta is basically pioneer in everything, right? But in terms of forensics, if you read the history, everything is first established in Calcutta, right? So whether the anthropometric bureau, the fingerprint, the question document, serology, ballistic, even state lab or the central lab, whatever the lab is related with forensic is first established in Kolkata, but not any single academic institute is established before 2020. So but anyways, so Calcutta is called just city of forensics. So my presentations will cover the justice system and forensics, especially I focused on the Karnataka. The evidence, what is the meaning of evidence and why it is admissible, what are the admissibility standards. The next one, DNA, the basic of timeline of chronology of DNA technology development and application of DNA technology in different kind of cases, right? Then finally challenges and what kind of solutions we have to do. So this is the brief highlights of my presentation. Karnataka, definitely big state, we 5th or 6th in position. But why this is important to us? Because we are a field of maximum from scientific field. So Karnataka is a pioneer in the scientific field. Whether you can discuss the Scientific Institute, IISc Bengaluru. There is no other option to any science student of the India. Their dream is IISc. Like if you are from law, NLSIU, HAL, DRDO, ISRO, all these institutes are especially in Bangalore and Karnataka. So definitely in scientific field, Karnataka is played an important role. So salute to basically the authorities, the initial researchers and the students who made this thing possible. Now next, can we minimize this so that completely slide is visible? Now there are few more good things. Everyone knows that Karnataka, who is a pioneer to create the post of SOCO. This is a leadership, and other states are following this. Karnataka, not any government institute, academic institute, not any especially FSLs or CFSLs primarily focused on Karnataka, but the first state who start this SOCO. Definitely, if people are learned, if the officials or the government is learned, they can understand the value of forensic. So I salute to the government to Karnataka to start this, and definitely the academic institutions or the students played an important role in this. So thanks to all the passed out students, all the pursuing students to take up this kind of initiative. Now the things change, Forensic, definitely SOCO. But in forensic, if we discuss, so if you invite the people from, because forensic is a wider domain, right? We have a ballistics, we have a biology, serology, chemistry, toxicology. Likewise, forensic psychology. If we can invite an officer from forensic psychology, definitely they will speak forensic psychology is the only solution for any crime. Definitely, है ना, they have to strengthen. But whenever, even the Ajmal Kasab case, recently the Shraddha murder case, there are so many terrorist cases. Yes, okay, because that is important, and they will not accept that we committed this kind of crime. So forensic psychology is the solution. But there are two articles 23 and article 21, है ना. On the basis of these two articles, there is a famous landmark cases of Supreme Court, the Selvi versus State of Karnataka. Have you any idea about this case, students? No. This is the case who stopped us every time. Only this is the case. कि these techniques, narco analysis, lie detector and brain mapping, है ना, were declared as a violative under these two constitutions. It means in normal cases we are not authorized. If in normal cases these are not authorized, then what is the meaning? If a matter is related with national security, then it is permissible. Or if court can allow, why court can allow? है ना? Due to the case, this is the subjective matter. Court will decide कि we will grant the permission or not, है ना? So another important case, this is just in 2017, the former and very famous High Court judge of Karnataka, K.S. Puttuswamy. This is a case of Puttuswamy. Yesterday, if you people were there, the Rukmani madam showed you one picture in which the Justice Malimeth was present, right? So in 1980s or 90s, one Malimeth committee was formed by the central government for the strengthening of the scientific deliveries under the use in the criminal justice system, right? But now the things are changed, right? This case is also on same basis on the right to privacy, the violation of right to privacy. So Justice Puttuswamy filed a petition, in the Aadhaar. Now everyone having the Aadhaar, so he is against the few laws of Aadhaar. Aadhaar is basically a different kind of law, definitely beneficial, right? He said that this is a completely violation of the right to privacy. How? On the basis of this Aadhaar or biometrics, the government can surveillance to the public, right? So we have to change. Basically, these two cases are related with the right to privacy. And how right to privacy is important, because in few cases, we all knows about the voice. Voice is a good forensics evidence. Even the cases we used, physics division, there are so many voice related cases. This is a new form of the digital forensic voice is used. But problem is, if you are going to submit the report in the court said no, voice sample is not admissible in that. So this is we have to see. This is the one famous case of 2021, Mr. Virendra Khanna versus State of Karnataka. The case question on is asking the accused to furnish password, self-incriminating and violation of the right to privacy. Suppose suppose I am a criminal in any case, right? Because you people invited me, so not you, I. So I am a criminal, police arrested me, in mobile to the explosive in present scenario, he has everything. It has everything, like locations, whatever the sensitive materials, everything, right? So I know what kind of evidence is present in my mobile phone, right? Police arrested me. I will say I will not provide you the mobile. उन्होंने ले लिया जबरदस्ती लोग. But now mobiles are password protective. If they ask me the password, I am using Apple. If you want to crack the password, ask the Apple, and Apple will not give you. है ना? Initially BlackBerry, right? So these are two mobile companies which are very sensitive to what the customer service, right? Samsung, so they can easily break the mobile. So I'm using all the confidential things with mobile, Apple, right? So I am not giving you the mobile and even password. This is a case related with the password. This particular person is the from student of the RB, I don't know, RB College of Engineering from Bengaluru, right? And after the completion of the course, he joined his company, and after 1 year he left, and after in 2018 or 19 he left, and after 1 year in COVID he was in Delhi. Suddenly the police of Bangalore, right, CCB police, I don't know what is CCB, in the judgment CCB is mentioned. So CCB police, right, visited his house and caught key 2 years before you were involved in one NDPS case, right? He has no idea about this case. He had given the mobile and other things in password, there is no thing, right? Then in the court these things are discussed. This person is not providing the password. When he know things has changed, he is like now convicted. So now he is not allowing. The court in another direction allowed to the prosecution for the lie detection. So against he filed these are the clear-cut violation of my right to privacy, and court admitted it. Now no password, no right to privacy. Now what is the, if he is a suppose criminal, right? So what the court will do? Because in justice system we are bound with constitution, we are bound with laws, right? So this is just for example, because this is just case for Karnataka, so I took this. There are n number of cases, right? If we are taking discussing about the voice samples, so the Andhra court said ki voice samples is not allowed, but the Delhi High Court says ki voice samples is admissible, right? So these are the things which we have to know. Now this is a controversial thing, right? Government, I am not talking about the state government, right? I am talking about the union government, right? The directionals are like in the picture now, opposite. If you ask the job, recruitment, anything, what the person says, make in India, no government jobs. Agree? Even in forensic, if you ask entrepreneurship karo na, why you are went for this job? Government is not giving you the job. Agree? Forensic students are very simple or shy. Okay, we are following the order. We are doing internship, no issue. So in the startup, number of forensic students in last 2 years more than 50 forensic organizations, these private, are established. Because I saw in the LinkedIn, I will not discuss a name, but number of organizations has been established. Because we are good citizen of our country, we are following the rule of government. Make in India, startup, entrepreneurship. But judiciary, no. What is the contradiction? This is it. All these cases are recent. This is the 3rd day of the September 2024. Just 6 months back, right? Court is also accepted, no. FSL report of private laboratory cannot be bind without considerable ground. There must be strong reason. So again, the startup or those who are like doing this private job is happy. Court is in with you, right? अभी 3 ही महीने बीते थे just in December, 6th of December 2024, another High Court decision. High Court flags concern over private forensics, impact on accused right. In this particular, this is a just irony of the case. Achha, I am not discussing in detail. Please note it down, these cases. These cases are very much important, right? This is a case of just rupees 5,000. And if he asks 5,000 for any private lab, they will give. But not file the case. Because now, because of this case, the authenticity or integrity of the private labs are in question, right? What is the case? The person, Ramachari, in election, Lok Sabha election, his motorcycle is seized. He is using motorcycle, to just imagine he is a just common man, right? Okay, in election, after 1 or 2 months when election is over, I don't know his party is winning or lost, definitely not win, otherwise his vehicle definitely be released. So after 1 or 2 months, he has to file a petition in the court, right? So court allowed and just fine of rupees 5,000 and his seized vehicle will be released from the police station. He visited police station. This is the court order release. When the person's been in a court, he is behaving like a king. Now I have a court order, just release. So sub-inspector asked the inspector, he refused. So SI told him, just met with my officials, inspector. He met with his inspector. He asked just give me 5,000 rupees, I will release. But the matter is only just 5,000. Because he has a court order. If he has a court order, we are common men, so why I will give you? So few conversation was recorded, then he submitted a case, right? When he submitted or filed a case to fight with the government or police, it is very easy to see in the movies, the police are and the agencies are very simple. This is not true, right? So he transferred the case to the Lokayukt police, all things are managed easily, right? Lokayukt police sent the boy's sample to the one private lab, right? And submit in the court. And now the decision is in against, right? So when in against, he filed an against case in the Supreme Court, High Court. When High Court analyzed the case, this is a gap of procedural law. If you are a state FSL or regional FSL, why you send the boy's sample to the private lab? If you have no government lab, or maybe some kind of difficulty in the transportation of the evidence and other things, okay. But if you have a state FSL, then what is the need to send the evidence related with the accused in the private lab? So if these decisions are in picture, what is the scope of private forensic labs? So students or the concerned persons of forensics are in the dilemma. What we have to do, right? Justice. What is the meaning of justice? If we can discuss the fairness, equality, equity, But for me, justice is how to enforce laws, because we are living in a society, right? So therefore, society, there are some rules and regulations, है ना? So how to enforce that laws? Human rights are always on priority, है ना? Then systematic investigation and fairness, transparent legal processes, impartial judgment, है ना? These are the normal definition of justice in present scenario. Evolution of justice system. India is very diverse in nature. India has very rich diversity of all the things. So if we can discuss the justice system, how it will evolution, so like in different Indian Vedic literature, we have it distributed in the 4 yugas. We have a Satyug, Treta, Dwapar and Kaliyug, है ना? And all these system or justice system, है ना, is basis on the basically the dharma, and as dharma declines, justice moves from self-regulation to the corrupt system. If you can read the examples, even Bhakt Prahlad and Hiranyakashyap say, case Prahlad knows कि whatever I will do, God will save me. Right? Whatever happened with me, God will save me. The pure dharma system, right? And he was saved. Now the things change. Now the king system, right? Ram Raj, right? In Ram Raj, now the oral testimony come in picture because the king. So when the public raised a question on his wife Sita, there was some what he did, everyone knows. I will not discuss in detail, है ना? So again, these dharma like declines. Now in the next yuga, again there are few questions, and now present system, right? This is everyone knows the corruption, the bribery, all these are issues. But we have a hope that things will change. We have some religious points, whether we are from any religion, but we have faith, है ना? This faith is like called God. Whatever it is like God, Hindu, Muslim, Sikh, whatever is religion. But we have a faith in our religion, right? So still we are hopeful. So only 25% is remaining, but 75% is lost, है ना? This is Kali Yuga, and money is most important. So this is also called Arth Yuga, है ना? So time flies, everyone knows, है ना? If we look at the examples, so whatever the communication methods, even Bahubali can use, है ना? Just heroine ना, which one था? Rani, his mother, his name, है ना? Send them this prison to send the information कि अपनी मतलब heroine को भाई लेके आओ, whatever this, है ना? So he used this prison, but in present scenario, she is modernized. Just send an email to Prabhash. Why just no? So time matters. Like surveillance system, है ना? He is not able to see anything. So one person, he is far from the, है ना, war, but he is still like the CCTV, na? How these things are happening, है ना? So only time. Time is basically decide the need, है ना? And need is the important to decide the research, because all these things are society oriented, right? So now we understand whatever the science, whatever the technology, right? If all these things are for the benefit of society, then that is important. In justice system, initially the things are based on confession, right? If someone confess, then he is guilty or not guilty. And how to confess, police knows very well, right? But because of third degree and other things, right? But because of human rights and other things, the system changed. Now confession is just absolute. The word is used conviction. To conviction means to prove guilty, and in between the confession and conviction, forensic occurs. we have to prove, like with the help of forensic, we are proving the, basically this person is convicted or not, right? This is just an example of the conviction rate of NCRB. Data is available 2022. If you able to see, in the murder, conviction rate is high, and in the rape, conviction rate is less, right? If some in rape, like maximum cases, the survivor is live, the like liveliness or dead is 20 to 30%. But in murder, so definitely died, So where the person died, the conviction rate is high. But if he is still alive, the conviction, and overall crime rate of India is around 26% conviction. We all know that these are the stakeholders of criminal justice system, Definitely, if I will ask you, now who is the person who knows about everything of the crime? Definitely is the criminal, So we have to work on that, not the police, forensic or judiciary. So we want to take the information from the criminal, whatever, from the direct evidence or the indirect, primary or the secondary. We have to collect the information from the criminal. This is the normal definition of forensic science. Everyone knows. Those are the like scientific technology which are used in the law enforcement is called forensic science, right? Fusion of law with law. If I will ask you the fair definition that is in your mind, how you can understand the forensic is, right? This is very controversial, but this is true. Is it true? No one tells you this one. Everyone like the previous slide, There are a lot of scope. There are a lot of job. Now the government is doing this. Now these are number of posts are advertised. And last year when criminal laws was enacted, more than 10,000 vacancies each year. We don't know that out of 10,000, maybe only for one university that 500 vacancy or like that. This is a reality. This is a bitter truth. But why? If there is a problem, it is only our duty to find out a solution. Right? We have a concern, but how we solve this? This is our duty, so we have to solve. So the question is why forensic analysis or forensic is important in present justice system. There are two cases, right? Yesterday definitely discussed with the Arushi one, the crime scene was disturbed, right? Samples was not properly collected, all things is okay. But the case is decided in the 5 years, right? In another, the Nirbhaya one, case is decided within 9 months. Because of the like this time gap, so scientifically if evidences are properly collected and court testimonies are like in fast, so we can decide the cases in just 1 year, right? And after Nirbhaya there are so many things, right? I will discuss after this in detail. It means law believes on only evidence. Whatever the other things is no need. Evidence and its proper scientific analysis. If these things are happen in any case, court can decide in within a year. If these things are not happen, definitely cases, dates. This is a continued process. Okay, we discussed the scientific techniques is required definitely. What scientific techniques means and which scientific technique is, there are few points which always we have to keep in mind. Scientific techniques should be smart. We all know, smart. The TV be smart, phone be smart, cities be smart, right? Then what is the meaning of a smart? Anyone knows? This is not smart, so we have a problem. Smart means technique should be specific. Specific, suppose we have to identify or examine a poison, right? But suppose we have to separate the component. So separation for these chromatographic techniques are there. Means specific we need. Specificity is most important. So technique should be specific, measurable. Like quantitative analysis is also important. You read na qualitative analysis and the quantitative. है ना, quantitative is most important for forensic people. So measurable, attainable. Like people believe it is not required that we need the Nobel laureates, है ना, to use that technique. Attainable, it is easily attainable by all except the realistic. It is not like the Hollywood movies, na, fictional movies. These kind of technology, realistic. It can be work in forensic though, it can be work on the real life samples, time bound. We need the technique which can solve which can analyze the evidence in just short span of time, because time is also, if these things are present, that technique is smart, right? What is the definition of evidence? This is all knows, right? Basically the proof, है ना? Evidence is again, है ना? Everyone knows कि Shri Ram gave the his ring to the Hanumanji, where to give the Sita Maa to prove I am sending this, है ना? So evidence is not new, right? But in history also there are 4 categories of evidence: Lekhya, Sakshi, Bhakti or Divya. And in the history, it is the evidential value is high. Lekhya means document. And if in the current things we read the law, the documentary evidence is superior than the oral testimonies, right? So for India, like people say, now our India is very rich, whether in the scientific things or the other things. In the science, definitely if we start the science from the class 6, whether the geology, this word is used from like either the Latin language or the Greek language. If I ask why only these two, in the China they believe the Chinese history is high, but in our books this word is read with these two words, right? Our literature having a sufficient evidence, only we have to read. But if I ask a question from the forensic fraternity, what is the meaning of evidence? Right? For them, the meaning is either biological, physical, chemical, right? The body fluids, firearm. We all know these are the, if some lawyer ask you what is the evidence, definitely you are explaining this thing. But can these things is a evidence in court? No. Court have a specific definition. Law have a specific definition. Ki anything admitted by a court to prove or disprove is evidence. Admitted by a court. If not admitted, then is not evidence. Maybe blood is evidence, but if any case not admitted, that is not evidence. These are the few types of evidences mentioned in the law, like oral evidence, document evidence. For these laws, there is certain sections also decided. I write the previous one, Indian Evidence Act, and the latest ones, Bharatiya Sakshi Adhiniyam, right? So these are the different categories of evidences, right? So we have to understand the value of these things. There are few standards everyone know, I will not going to discuss in detail, these are little bit boring now, so I will discuss the case studies. There are few key factors which are basis of the admissibility of, these are as per the Daubert. 3 things which are important to decide the case. Fact, reliability and admissibility. We have to understand the meaning of that. What is the meaning of admissibility? The admissibility of evidence means any document or testimony used in a court of law. And all evidence is not allowed in the court. Only those evidence which is reliable. Which is reliable. It means which is related with the case, which is related with the criminal, which is related with the crime scene, are only admitted. It doesn't mean that someone is like A is discussed with the B, and now B is giving the testimony in the court. So court never believe these kind of testimonies, right? Who decide admissibility? Only judge has a power to decide if this evidence is admissible or this evidence is not admissible. Means he discussed the various things like in laws which are mentioned with the prosecutor and the counsel. In which section? 136 of evidence and 140. They have a specific power, right? Like the forensic psychological techniques, right? In national security related cases, this is allowed. But in few cases in which the judge seems key, this should be acceptable. These are the heinous crime. So court can grant the permission for the psychology. Means judges only has the right? But on which cases the court has to ensure that proper investigation has been carried out or not. Few type of questions should be decided, because when police collected the evidence and sent it to the official for examination, some questions they asked to the police. I am sure ki you know about the Lokpal, and the Anna Andolan related with Lokpal of Delhi, why which the one CM has been appointed in Delhi and all, that is a famous Andolan. One case was happened, one CD, one voice has been leaked, the voice is from former late, like the minister Manni Mulayam Singh ji, the late Shanti Bhushan ji, who is also former, and Amar Singh ji. The voice is like in the conversation. What is the Shanti Bhushan said to the Mulayam Singh and Amar Singh, कि my son Prashant Bhushan, who is a senior lawyer in the Supreme Court, he will manage the judge, right? This is the time of when Lokpal Andolan is on peak, right? And someone leaked this voice, when they leak, so police send the CDs, and CDs are copied, right? So police ask the question to FSL, please provide the genuineness of CD. So the CFSL says this CD is also not genuine. Please provide the genuineness of CD. So what CFSL says, this CD is also not genuine. This is copied, right? So what kind of questions we have to ask? These questions are determine everything. These are the general questions, right? Why the crime has been, this is the everyone knows, but the main question is who committed the crime, right? This is the most important thing. Who? Because ultimately we have to find someone, right? So this is the main question to decide any case. And who means personal identification. Why personal identification? Where personal identification are useful in law? To decide. Generally people think if forensic is only for criminal law. No. These are useful in civil cases also, right? So these are few cases in which we are using the personal identification techniques. This is the just evolution of personal identification techniques. It started with fingerprint, the portrait parley, the blood grouping. I used like 1934, where protein typing and other things are started. Not the blood group was started by Landistiner. When protein typing was started, I used that one. Then the 1984 to DNA fingerprinting. This is till now the gold standard method of the personal identification. This is the just brief of discovery of the DNA structure. Start with the nucleic acid 1869 to 1953, the Watson and Crick, when the double helix model now. So this is the DNA structure of discovery. This is the timeline of discovery of DNA typing. It started with Sanger sequencing. We can actually see the bands and all the things. So the things start with the Sanger and the AFLP, the PCR. 1986 pitchfork case, when Alec Jeffrey solved the case, right? All these things, 97, 98, FBI launches CODIS and NDIs, then 2001 anthrax case, 3 human genome project, all these things are okay. But in 1998, FBI launches CODIS, right? These STR markers dataset having 7 to 10 STR marker. Initially, these STR kits having the 7 STR markers. Till 2001, the number of markers is increased around 10 to 12. Right now, more than 30 marker system kits are used. 27 are well recorded, but more than 30 marker system are in the market. Now the things is, all these things are okay. Now the question is related with the personal identification. Which one is the landmark case to read? If anyone asks me, right, I will discuss the suspicious death of Netaji Subhash Chandra Bose. That is a big case, right, to discuss. There are so many commissions was constituted by the EU. There are so many controversies. There are so many stories. In one story is that Netaji's are ashes in the one country, right? The particular temple, I did not recall this time. One story that one Baba, who is living in the Ayodhya, called Gumnami Baba. Read this Gumnami Baba stories. But initially, the government believes that Netaji was found dead in the 1947 in a plane crash, right? And in the first commission report which was constituted by the Indian government, it is clear-cut mentioned. But when the last commission was constituted on the direction of the Honorable High Court of UP, in the last commission, out of 92 oral testimonies, 85 testimonies, it was written that Gumnai Baba is the Netaji. Now the conclusion of the commission or report is that Gumnai Baba may be Netaji Subhash Chandra Bose. It means it started with no. Now the government believes that maybe, and if we analyze the things properly, so maybe can we convert. The question is, in 2002, the bone samples or teeth samples sent to FSL, CFSL and the CDFD for the examination of matching the DNA, right? CDFD says that because of the degradation or low yield, if MSc people, because of few technical terms. So I tried to make my lecture something interactive. Low yield. Yield is very important for profiling, right? Because of low yield, we cannot generate the full profile. In the samples, yield is. On the other hand, CFSL says that this particular DNA is not matched on the basis of only 4 markers. Later on, the international standard says even 4 markers, it is not possible to match. So that this marker system is increased, right? Now we have 27 markers. Even at that time, if 10 markers are used, why the lab used only 4 marker system, right? So we have to generally suggestion is, suppose we are the 27 marker system are using in present time, and if you are using in any case 4 marker system, if judges will ask why you are not using this technology which is updated, so that is a question, na? So we have to understand all these kind of things. Why DNA justice system? Everyone knows. So I'm not focusing on this. I will focusing on the. This is a few cases. Means I use only few one, right? The criminal identification for paternity testing, missing person, human trafficking, sexual assault, ancestry. है ना? I categorize these few things. Everyone knows Shraddha Walker case. है ना? What happened in this case? The Shraddha's like is cut into 16 parts, na? And all 16 parts are sent to the different locations. है ना? So first police have a like challenge, but this was a like matter of seriousness. He agreed for lie detection, and on the lie detection he informed police that I am throwing this body part to this particular forest, and the police collected, and the DNA exam, on the basis of DNA examination we proved. This is a best case, recent case in which DNA technology is useful and admitted in court of law. I will discuss these cases admitted. In few cases which are a challenge, I will discuss later. So paternity testing, like the yesterday madam says, ND Tiwari, again this is a landmark case, है ना? But on which ground? Because we have a idea कि mother is a fact, right? But father is a father, that is a belief. है ना? Right? So in paternity testing, this is important. Now, these two things like missing person identification and investigation of human trafficking, these are the latest one. Right? There is no specific guidelines. If you can see the trafficking cases, na, India was on the top. है ना? If you see the NCRB report, more than 5 lakhs people are, है ना, missing. So what is the procedure to identify? What is the procedure to find? What is the procedure to solve these kind of cases? है ना? First we have to understand that these are the few categories in which the UNODC, this is the like body of the United Nations, this particular crime is listed in the list of the UNODC. It means this is sensitive. But again, till now, India have no any specific guidelines to deal these kind of cases, right? So one scientist, basically he is my collaborator also, he started this work from 1999, started with the first national missing persons genetic identification program, right? He said if we have a database, then we can easily find out the persons who are missing, right? DNA Pro Kits, he started this program. Suppose if someone is missing, having like a more than 4 year, 5 year, he is able to speak, then to no issue. But if a children is missing below than 2 years, how he will speak, how he is pronounce his name, address and other thing. If you see the Bollywood movies, right? So every twins, whether brother or sister, has missed in the Kumbh. In the previous 1970s or 80s picture, if any twins is, whether Sita, Geeta, Ram, Kishan, Ram, Lakshman, jo bhi hai, one brother or sister has been missed in the Kumbh. Every time this is it. So, suppose at the time of missing he was 1 year. After 20 years, it is very easy to say, these are like, if identical twins, maybe. But if not identical, then how will you identify? How will you prove? The photograph is changed. Only the DNA, right? So, DNA Pro Organ 2016. Now the cases of organ trafficking. Suppose if we recovered one or jar filled with like different organs of viscera, how we identify? Can this liver or heart will speak? Ki I am heart from this particular person, like animal movies. Ki iska heart laga. This is not a film. right? How we will solve? है ना? So if we have a DNA database, only because of that, है ना? Because the traffickers kidnapped those persons who are like isolated from the family, or that there is like some other grounds, right? Sexual assault, there are 2 cases, Nirbhaya. I don't discuss, only discussion is matter कि one juvenile is from 17, right? So after this case, the POXO Act come in picture, right? And juvenile age is decreased, right? This is the main thing which is important to learn. Otherwise, the case is same. RG if crime scene is disturbed, है ना? We cannot identify, because at that time the body fluid was there, and from the body fluid we can like identify कि only one person is involved. Initially story was कि 5, 6 or 7 person was involved, but finally only one person is involved. This is also important. Ancestry, there is one case how this DNA is important to make good collaboration with the different countries. In 20 years back, one near the church of Saint Augustine in Goa, few bones were recovered, है ना? From the history literature, that things is like recalled कि maybe that bones belongs to from some Georgian queen, है ना? And after the ancestry, from the like the government took the samples from the Georgian family, and they easily identified. And this is the first ancient DNA case of the India. The another one, the Ajnala case. This is in the Punjab, where more than from one well, more than 250 skeletons was recovered. Suppose if more than 250 skeleton, I mean, this is so basically a good business, like people are using it for magic, है ना? 250 skeletons. But the question is, all these 250 skeletons are belongs to the persons who are involved in the independence. These all 250 persons are from the Bengal infantry regiment. है ना? Britishers killed all these and like persons and like thrown in to the bell. So after 150 years, because if suppose my family is involved in this kind of independence one, so like some kind of recognition is important, है ना? From ancestry we can recognize कि we are like believe in nation, right? Modern investigative approach, mosquito, definitely in Calcutta to dengue we are like दूर रहो, है ना? But because of mosquito, how can we solve the new approach? This is a case of China in July 2022, है ना? What happened? Like one recently painted flat, है ना? One criminal entered into the flat, newly painted. The TV was there. He saw the television. Maggie there. So when the police reached now, he found the Maggie's packets and a mosquito coil, because there were so many mosquitoes there. But no fingerprint, no footprint, there is no CCTV camera, and like there is like maybe few articles has been installed by the criminal. Now in China they have to prove, because he used mosquito coil, so it means there was a mosquito. So on one wall, one mosquito that was smashed by the criminal found on the wall. So in a newly painted house, for just curiosity, the investigator collected the mosquito, and from when they analyzed the DNA, they found in mosquito DNA one human DNA. When they isolated human DNA and matched, so there in database it is recorded that this particular DNA is involved in one crime. And when they caught, he admitted, yes, I am entering this, because like in the mosquito, the digestive time of the human blood is 15 minutes. If we can get the mosquito within 15 minutes, our human DNA can be isolated from the mosquito. If after 15 minutes, our human blood is digested by mosquito. So these are the how the technique is advanced. We have to understand. This is another case which is solved. This is a manufacturing unit of the insulator. Acha, everyone knows about the businessman. Suppose if we have to save money. Suppose I am a manufacturer, I have to open a factory manufacturing factory in Bangalore. The cost is high. If I will open in some village or any like local area, so maybe government will give some kind of subsidy. So this kind of system in Rajasthan, the manufacturing unit is sanctioned in the Jodhpur because of some kind of subsidy and other things. But they have to send the insulated first Jodhpur to Jaipur, then Jaipur to another city. So huge cost. So businessmen are always in mind na how to save the money. They think Jodhpur छोड़ो Jaipur में रख करते हैं, right? So they manufacture insulator in Jaipur, but in the document factory is running in the Jodhpur. So when the excise department got to know that these things have happened, because this is a matter related with tax, so they raided. Because in every team there is one spy. So spy called the businessman, kal raid ho rahi, right? So we are aware. Now what happened? In one day he cleaned all the lab means factory, right? All the laboratory facility, all the instruments, whatever the machinery, is cleaned. Police reached with forensic team. Everything was cleaned. In the oral testimony, just yesterday was the holiday, just 2 days before, just factory was closed due to some holiday. Today is just open because of your investigation. Okay. And every like security guard and the other staff, admitted. Yes, just 2 days before, factory is working. But what happened when they investigated? Everything was cleaned. Everything was there. But in forensic, we can easily identify what happened. One trolley is used. Suppose one in the machinery, insulator is manufactured and then shifted to trolley, and because with the help of trolley, the insulator are shifted. It means in the manufacturing process, machinery, that trolley role is important. So there were number of spider webs are present in the near wheels of the trolley. If spider webs are present, it means the trolley is not used at least 7 to 10 days before. They cleaned all the things, even trolley is cleaned, but this particular area, see how it is possible. It means manufacturing is not possible in between at least 7 days. Now the question is, they have to prove how much like long back this was not happened. So they analyze the spider web and the particular genetic profile of the spider and identify first this spider belongs to only Jaipur. This is the site specific, and this is at least 3 months old. So with this is a modern investigative approach. We don't think how these spider webs are useful. Challenges. This is a most important thing. This case is solved by the FSL Rajasthan team. Asifa. I always discuss about this case, why this is a challenging for us. This is a case of the sexual assault of the, I have 5 minutes more or 10 minutes now, okay. So this case is like for rape of 8-year minor girl. This case is of 2018. This is a Muslim girl, and raped in the temple by all Hindus, right? So it means how the case is sensitive even in Jammu Kashmir. This case, because of this case, this will spread the communal rights, and 8-year minor girl, right? What happened? So the irony is, when the evidence is sent for forensic examination, I will not disclose the name of lab. I just discuss the case. It is your duty to find out, right? Because this is a public platform now. I will discuss the facts, right? So when the evidence was sent to the FSL for examination, right, not any single profile is generated. Means DNA is not extracted. In the report, no DNA is found in the evidence, right? What does it mean? If no DNA is found in the evidence or the cloth, it means this is not a matter of race, right? Because this case is very much sensitive. So what court did? This case is transferred to first Pathankot, because this case is sensitive, not like performed in the Jammu and Kashmir, right? So what court did? Due to the sensitivity, the evidence was sent to the another FSL, right? Judge can allow, right, for retry. So just with the one FSL retry, the another FSL successfully extracted the DNA and generated the good profile. And because of that, we can prove, because we have a list of accused, right? When the DNA is matched with the accused, the DNA is also matched. But the question is, when this is sent to one FSL and DNA is not extracted and another is extracted, why? I'm not discussing the integrity, but we have to understand the meaning of calibration of instrument and all. So maybe there will be a instrumental lack, so this is a big challenge. Another case, this is a hot cases in present scenario, the Anokhi Lal versus the state of MP. Maybe you people are aware. Ye Anokhi Lal ka bhi anokha case. In court is giving the judgment for death sentence 2 times. Again he's fighting in trial court, in high court, in Supreme Court. Supreme Court said, no, there are procedural gaps in the case. So again, back to the trial court. Again, trial court give death sentence, 2 times death sentence. And when the 3rd time, acquitted. So who is responsible for just 12 years? At the time of, I think, 2011, 2012, he is 21 years old. His life now is no mean, na? So he is responsible. So this case is very interesting. This case discusses the standards of DNA technology used. Because of DNA technology, it is proved that this person is involved in a crime. And he is saying that I was present but I am not doing this. So this is a best example to read the different standards related with the DNA technology, and court agreed that DNA standards are not followed properly in this case. So the person is acquitted. Everyone knows about this case, Shashi Tharoor, right? This case is not related with the DNA, but this is a challenge of justice system, right? In this case is of the 2014 January, when the his wife, like Sunanda Pushkar, was found dead in the Leela Palace Hotel, right? The irony is, in the Bisra examination, autopsy was happened in the AIIMS Delhi, right? Bisra preserved, sent to the CFSL, right? This is the normal scenario. But the irony is, AIIMS opinion is, this is a poisoning death case, right? When CFSL report out, they says there is no poisoning detected. There is no question on the integrity of these institutions. If you are like 12th pass biology aspirant, so and your medical science is your aim. AIIMS is the like first priority. Even in AIIMS Delhi is the top one. In forensic, CFSL is the highest level, right? So there is no question. But up now, CFSL says there is no poisoning case, no poison detected. AIIMS says there is a poisoning case. Both these institutions are in the court. Now just think you are a judge. आप भी क्या करोगे, right? We have no option. And scientific, later on if these things are sent to the one FBI lab, so read the judgment, read the story, है ना. This is another case of Rajasthan. One lady was filed in case of rape कि this particular minister है ना raped me just 2-3 days back, right. She submitted few evidence, right, and from the evidential analysis it was proved कि the DNA is matched with the minister. Now it is proved, but what is the matter? Then the minister was to resign. Minister said कि this is not the, because the sections are rape, है ना, initially 375, right. So what the question is, he said कि this is a consensual, consent is there, and this is a evidence is from 1 month or 15 days back. Definitely my DNA is there, right. But in the testimony she said कि this is just 2 days before, but definitely there were 15 days or 1 month before. So now this is a again thing कि if DNA is found, right, it was, he admitted कि yes. Now if suppose that stain is 15 days or 1 month before, so it was proved कि this is a wrong case filed by the person. So punishment is different, right. So because of that DNA, although now people, researchers are saying DNA degradation is possible, but because of this short period, we can solve these kind of cases from RNA, because RNA degradation we can easily use, and even the spectroscopic techniques are used, right. But with the help of DNA is not possible. So this is a one example. If DNA is found, so the term is called fabricated DNA, right. So courts are facing these kind of fabricated DNA sample cases where DNA is found and matched, but the person is saying I am not visiting that scene. So how we will solve? So this is a big question to all forensic scientists. Another, I think only last cases, these are genetic aspects of criminality. Suppose if someone person is mentally ill, right? Even in RG case, it was proved he is suffering from any disease, mental disease, right? If it is proved that this person is mentally ill, what will be the judgment? What will be the punishment? It is like not cruel, no? It is like lesser punishment because the person is. This is a one type of approach, कि only there are 2 genes. This is not related with India. Globally, only 2 genes are responsible for any criminal activity. This is MAOA or CDH30. Up suppose I am saying this, I am not doing this because of genes, I am doing this, and this is proved. If suppose because of disease, the punishment is some reluctant, because of this genetic disorder, if this thing will be proved, then only 2 genes are responsible. If these 2 genes are not prominent in my genetic profile, I am not doing this. So the justice system, again we have to look into these kind of genetic things, right? So these are newer approaches. Just the solution is that we have to maintain the good standards, we have to make a strong databases. So I am hopeful within 6 months, because I think all things are in process. Now we have a good database, DPDA Act, who relies on the databases security and all. So DNA bill will be coming to the picture within 6 months, right? So these, on the basis of these suggestions, thank you all.
धन्यवाद सर जी. Thank you, sir, for the insightful presentation. We will now open the session for questions. Delegates, please raise your hands if you have any questions, and we will pass the microphone to you. Online participants can send their questions to the chat box.
If you have any doubt, ask me anything. Zubair.
Sir, in bone marrow transplantation, usually a person will have 2 DNA. So
Not 2, 3.
Hi.
3 also in few cases.
So how it helps?
Yeah, this is a challenge. I have a limited time, otherwise I will include this also. In one case, है ना, the blood is present, the hair is present, है ना. When the scientist extracted the DNA, है ना, from the hair and blood, in the investigation it was like written that there are 2 persons was present, right? But when the things are investigated properly, it was found that only 1 person is present, because the matter is related with the transplantation, right? So yes, we have to working in the we have to take these kind of cases as a challenge, right? Yesterday I discussed one case, right? Ki just 3-4 months back, right? One case was happened ki one lady was lost her arms in an accident, and from the transplantation of hands, she is used the arms of the another person. When she visited bank for his financial transaction and all, so now we all know na we have to give fingerprint first, है ना? When she entered the fingerprint, her fingerprint was rejected, and when they investigated, so definitely this fingerprint is already recorded, already registered. So the arms belongs to that person who basically transplanted, who donated their arms. The fingerprint belongs to. Now she submitted an application to bank or to change her this fingers, right? How he will change? How she will change means, because already recorded, right? There is no specific guidelines in the Aadhaar Act. It is not clear if any person wants to change or clone. If this is not mentioned in the law, how they will change? They need so now the people who are involved in the system are working on this. We have to amend the laws. We have to add new guidelines, because the one fingerprint, cloned fingerprint is found in another state. Because of these forged cloning, fingerprinting, it is very easy to clone. In 50 rupees you can clone a fingerprint, right? There are a number of techniques which is easily available on the YouTube and other things, right? So if clone fingerprint is found, so what is the punishment? Is these things are mentioned in the act? Because ultimately we are bound with constitutions, laws, regulation, act. So if not mentioned, then we have to mention. Only when these things will be mentioned, even in the forensic practices. I discuss one thing, this is she's discussed wonderful question, this one challenge. Another challenge is in one research, when we research on the fireworks residue, right? So the residue having the similar result with the GSR. Suppose someone is having the particles on his hand, and he was involved in the these fireworks celebration and all, and police arrested and sent the swab to the analysis. So it was proved he is involved in the firing, so we have to identify these gaps, and only because of research we can solve these things. And in research, then if will prove, then we have to amend the standards also. This is more important. Any other thing? Yeah.
Sir. Hello, sir. So in the last bits of your session, you told that 2 genes are responsible for commission of crime. but then isn't it a little bit more complicated and risky when it comes to
Definitely.
saying
First of only this kind of research was started from 2005 or 6, right? Or till now only 6 or 7 papers are published. है ना? So I'm discussing now, if in future this will prove, है ना? If this will prove, then there will be a problem. So we should awake, है ना? We have also to work in this particular domain. If this will prove, so judiciary can look into to deal these kind of cases also. Because right now the criminals are very smart, na? They are submitting the fake certificates submitted from some doctor, na? I am mentally ill, and like enjoying the life in the mental hospital and all, right? And punishment is less. So to lesser the punishment, the criminals are using this. Suppose these things are possible and basically is recommended, then the judiciary we have definitely look into, if someone is deceased. So what is his or her fault? Ultimately we have to discuss the human rights, na? We have to see the human rights. So then the gene editing and the other things, well, we come into the picture, how we will solve these kind of cases. So right now the people are working on this. So after 5 years or 10 years, when the people started the working on Indian context also, till now all the criminals are from abroad, right? Different countries. So when the people will analyze, but if prove, then this is a big challenge to judiciary.
Thank you, sir. On behalf of ICAFS 2025, I extend our deepest gratitude to Dr. Ankit Srivastava for delivering an insightful and thought-provoking session on the advancements of DNA technology in forensic science. Your expertise in forensic genetics, DNA profiling, and justice reform has provided us with a deeper understanding of the impact of DNA evidence in the criminal justice system and the technological strides shaping the future of forensic investigations. We appreciate your time, knowledge and dedication to advancing forensic investigations. On behalf of ICAPS 2025, I invite Ms. Devi S. to give a memento and certificate to Dr. Ankit as a token of gratitude. We are truly grateful for your time and expertise, sir. Thank you once again for gracing us with your presence and for your valuable contribution to this event. We look forward to more opportunities to learn from you in the future. Thank you so much, sir. There is a short notice for the students from third year UG. They have to report to SK auditorium immediately, now. And after that, you are done for the day. One important announcement for the delegates: those who have not submitted their posters till now, you are requested to submit your posters. Final attendance for third year UG will be taken in the SK auditorium itself. So kindly be seated there. And for the delegates, we will begin with the online oral and poster presentation shortly. Presenters, please note the venues for oral and poster presentations. Offline oral and poster presentations, sorry. The oral presentations, panel 5, A3 auditorium, this is the same venue. Also, the oral presentations, panel 6 will be also happening in the same venue, that is A3 auditorium. Kindly note down this thing. And then poster presentations, that is panel 8 and panel 9 will be happening in auditorium A1, that is in the second floor of this building. So the oral presentations, panel 5 and 6 will be in A3 auditorium, that is the same venue. And the poster presentations, panel 8 and 9 will be happening or will be taking place in the auditorium A1, that is the second floor of this building. Our student volunteers will be guiding you to the venue. Thank you.
We commence the oral presentation session of this international conference where we shall witness cutting-edge research and novel contributions to the field of forensic science. Before we begin, it's my privilege to formally welcome the chairpersons of this session who bring with them vast expertise and extensive contributions to forensic science, Dr. Ankit Srivastav and Dr. Bhavana Desai. Dr. Ankit Srivastav is a highly distinguished forensic scientist, currently serving as an associate professor and director at the Center for Studies and Research in Forensic Science, West Bengal National University of Juridical Sciences, Kolkata. He also holds the position of Head, School of Forensic Science at the West Bengal National University of Juridical Sciences. With over 18 years of academic and research experience, Dr. Ankit has made significant contributions to the field of forensic genetics, DNA analysis, and forensic policy development. Throughout his career, he has authored numerous research articles and books published in renowned national and international journals. His expertise has earned him invitations for lectures and presentations in multiple countries, including the USA, UK, China, Singapore, Thailand, Netherlands, New Zealand, and the Czech Republic. Dr. Ankit is also an editorial board member of several prestigious forensic journals and serves as a reviewer for internationally recognized scientific publications. He has played a pivotal role in organizing the national and international forensic conference and seminars, some of which has been funded by leading government bodies such as UGC, DST, and ICSSR. His contributions extend beyond academia. He has been instrumental in the development of forensic laboratories in academic institutions and has served as an external supervisor for Rutgers University, Camden, USA. As an active member of the American Academy of Forensic Science and the International Society for Forensic Genetics, Dr. Ankit continues to advance forensic science through interdisciplinary collaboration, research excellence, and forensic education reform. It's indeed an honor to have such a distinguished expert with us today. Welcome, sir. Dr. Bhavana Desai is a scientific officer in the question document section at the State Forensic Science Laboratory, Bengaluru, specializing in forensic document analysis and handwriting authentication. She holds a MSc in forensic science from Dr. Harisinga University and a PhD from Karnataka University, Dharwad, where she conducted extensive research on the forensic examination and admissibility of question documents. With a career spanning over a decade, Dr. Bhavana has examined more than 400 forensic cases and has provided expert testimony in over 20 court proceedings, including high-profile cases such as the PSI recruitment fraud and KPSC recruitment fraud. She has also conducted on-site forensic investigations at more than 40 crime scenes, contributing crucial forensic insight. A dedicated researcher, she has authored nearly 20 research papers in national and international journals and contributed to Scopus Index book chapters. She is an active participant in workshops, training programs, and forensic science conferences, sharing her expertise with the academic and professional community. Her outstanding contributions to forensic research and document examination earned her the Best Young Scientist Award 2021 from the Eureka Pride of Education and Research Award. With her extensive expertise in the forensic document analysis, courtroom testimony, and forensic research, Dr. Bhavana Desai is a highly respected figure in the forensic science community, and we are honored to have her as the chairperson for this oral presentation panel at ICAFS 2025. I request Mr. Don Caro, Head Department of Forensic Science, to welcome ma'am with a plant sapling. an honor to have such a distinguished expert with us today. Welcome, ma'am. We now move on forward with the oral presentations, where researchers and scholars from across the globe will present their findings, contributing to advancements in forensic science. Participants, please note the time limit is 7 minutes for the presentation, and this will be followed by the Q&A session. I now invite our first presenter with the paper ID 25 ICAFS OPOF FCT01. Kindly note the paper ID is 25 ICAFS OPOF FCT01.
So, a warm good afternoon to everyone present over here. My title is Comparative Analysis of Heavy Metal in Smoke Cigarette Sample, Unsmoked Cigarette Sample, Smokeless Tobacco in Zebrafish, Tilapia and in Common Crab. So, starting with the introduction. Next. So, starting with the introduction. Heavy metals are nothing but these are the chemical elements which consist of relatively high density, approximately of 5 gram per centimeter cube, and they are considered to be poisonous when they are present at the low concentration. Some of the heavy metals are not essential for the human beings as well as for the animals. Due to the presence of these heavy metals, they cause damage to the health issues of humans and the environmental damage. And then these heavy metals are oftenly incorporated into the trophic chains via water, plants, microorganisms, fishes, and then they are majorly incorporated into the human beings through the means of drinking water and seafood. And then talking about the types of heavy metals, there are two types of heavy metals. One is essential heavy metals and non-essential heavy metals. And then the sources of the heavy metals are man-made and natural. Natural is weathering of rocks, and then man-made is agricultural, mining, and etc. Next slide. And then talking about the effects of heavy metals on human being. A various number of diseases and disorder affecting the immunological, neurological, and then reproductive gastrointestinal tracts, which are caused only major due to these heavy metals. And then in the case of a pregnancy woman, these heavy metals will circulate within the blood of the pregnant woman, and then it will affect the unborn child. And then talking about the effects of heavy metal on aquatic organism, heavy metal can cause both acute as well as chronic poisoning. Whereas, as we all know that majority of the humans usually consume fish as a source of food. These heavy metals which are present in the water will enter into the gills of the fish, and then through the means of food. And then the ability of the heavy metal to be absorbed usually depends upon the amount of the food that is being consumed and the water that has been taken. And the amount of the heavy metal absorbed is usually dependent upon the food and the organs. And then the primary organs for the fish for storage of these heavy metals is bone, kidney and liver. And then talking about the cigarette butts and effects, as we all know that cigarette is one of the most common type of litter in the worldwide. Approximately 4.95 trillion cigarette butts are being left behind every year. And then these cigarette butts contains toxic elements such as nicotine, lead and arsenic, etc. And then once these cigarette butts are broken down into the sea, and then the entire heavy metals will be mixed up with the water. And then the fish usually think these heavy metals as a source of food, and they will basically consume it, whereas leading to the exposure of the fish deaths, etc. And then talking about tobacco and its effects, Nicotina tabacum, as we all know that the leaf of Nicotina tabacum is usually consumed in the form of smoke and then chewing and crushed, etc. Next. And then these are my aims and objective of my research, that is analysis of heavy metal from the tank water after growing the fishes without any parameter. Second one is growing the fishes with parameters such as cigarette samples and pan masalas. And then the third objective is study on behavioral changes of the fish. And then fourth one is to understand the environmental pollutions and its effects on human beings. So methodology is sample collection. In my research, a total of 4 different brands of cigarette samples are used over here. That is Gold Flake, Players, Classic and Indimint. And then in the case of the pan masala, 2 different types of pan masala is used, Vimal pan masala and Shikar pan masala. And the fish sample that is used for the research is zebra fish and tilapia fish. And then sample preparation. These smoked cigarette sample and unsmoked cigarette sample are collected from two different locations, and then they are dissected into pieces and they are dissolved into the water. And this soaking is allowed for 2 days so that the entire composition is soaked well. And then the pan masala, 15 grams of pan masala was dissolved in 20 liters of water, and then the fish was introduced into it. And then in the case of control sample, no parameters was given as such. These are the figures. Next. And then observation period. Once these cigarette samples are completely soaked, the fishes are then released into the water sample, and then their observation is done. And then sample preparation for acid digestion. I have used the acid digestion method for determining the heavy metals. So in acid digestion, we basically cut the fish sample, that is from the gills through the anus, that is the vent, and then their organs is separated and they are stored in cold storage for the further processing. Next. So this is how the fish samples were cut and all. Next. The different types of organs of the fishes. And then sample analysis for acid digestion is 3 ml of nitric acid was taken in 100 ml of beaker, which was followed by 1 ml of sulfuric acid, and then it was kept in a hot plate so that half of the volume is reduced, and then the organs, the fish organs which was taken, is then dissolved into the solution, and then it is filtered out into 100 ml of volumetric flask. Next. Sample analysis, atomic absorption spectroscopy is used over here. Atomic absorption is nothing but the amount of light observed is directly proportional to the elements present in the sample. So these are the result part, the behavioral changes as I said. So zebrafish and different conditions such as smoked cigarette sample and unsmoked cigarette sample. Zebrafish contained for 15 days, and then that in unsmoked sample it was surviving for 20 days. Usually behavior such as erratic movement and then sluggish behavior, and then development of different kinds of blood clotting, and that's all. Next. Similar way for pan masalas and unsmoked cigarettes. Next. So these are my results in I use atomic absorption spectroscopy. I compared both smoked samples, that is smoked classic cigarette and smoked indimen. That is a total of 5 metals was taken: lead, mercury, and then zinc and cadmium and chromium. In smoked indimen showed higher level of heavy metals than that of classic cigarettes. Whereas in unsmoked sample also, smoked indiments showed more level of concentration than that of unsmoked cigarette samples. Next. Whereas in the case of tilapia fish, over here, players showed a lot of heavy metal concentration than that of the gold flake. Different organs were affected, that is bones, gills and skin, intestine, water, etc. Next. Similar with that of unsmoked cigarette sample, many of the organs were affected. Next. In pan masala, similar way. And then the control sample was done so as to maintain the integrity to compare how these were different from each other. Next. So in conclusion, many preventive measures should be taken so as to avoid the heavy metal deposition in aquatic organism as well as in human being. From these aquatic organisms only we are going to get this heavy metal deposition inside us. And also smoking and tobacco will directly cause heavy metal deposition into our lungs, etc., which will lead to metal poisoning in our cases. Thank you. Yes, sir.
You mentioned the control sample of water.
Yes, sir.
What is the control sample of the cigarettes?
Control sample of cigarettes. Unsmoked cigarettes, sir. Yeah. That is my control for.
Have you compared with the data?
Yes, sir. I have compared my data with smoked as well as unsmoked. Basically, we believe that smoked cigarettes contains more amount of heavy metals which are present in that. But in this research, I have proved that even the unsmoked cigarette samples will also contain heavy metals, even if it is not smoked and it is directly imposed into the water. Yes, sir.
Without water?
Without water, no, sir.
That control sample?
Yes, sir.
In the water, like you had the smoked one or the unsmoked one?
Yes, sir. control. No, sir.
What do you think? What is the outcome of your?
Outcome is this was done for a shorter period of time, so I didn't go for a lot of exposure and all. So outcome is so basically even unsmoked cigarette samples will contain heavy metals, whether exposed or not, and then that's also. Ma'am, basically I have done in tank water by growing the fishes from a small stage to a larger stage until they die. Whereas other papers they have directly taken from lake water, pond waters and all, and they have directly exposed this. I have not done direct exposure, whereas I have grown them to analyze their behavioral changes. Sir, metallic poison, sir. No, not.
In zoology also we have separate branch, right?
Yes, sir. Environmental forensics and then wildlife forensics we can do.
More related with the like for the zoology people.
So, yeah, yes, sir.
What is the like in forensic? What I expect answer from you now. What do you think?
So I said environmental forensics we can relate it to it, like pollutions and controls and all. Day to day it is increasing. Okay. Thank you, sir.
Thank you. Now the next presenter is 25 ICAFS OPOF FCT02. Kindly note the ID is 25 ICAFS OPOF FCT02.
Good afternoon, everyone. So, welcome to my presentation. Today, I'll be giving a short. I've done a very short study on the water sample. Okay, the water sample collected from especially in the area Kothanoor. That too, why I choose Kothanoor, because mainly the thing is that this is the area in the Bangalore which has higher population density and higher population as well, and many things like many colleges, education institutions, everything are in this main area, but still we are not having a government supplied water in Kothanoor, and we are mainly dependent on the tanker waters, rainwater harvesting and bore wells. So, as per the Times of India survey, every summer the bore well it dries out, and rainwater harvesting is not that much efficient till now. So basically, the people are forced to use this tanker water for our daily needs as well as household needs, basically. So, and there is a board regulating this thing, that is the Rural Drinking Water and Sanitation Department, and they are strictly obeying to the BIS standard 10500/2012. Next slide. So this is the main issues with this tanker water. Source is unknown. Maybe one day they will be giving taking from some legitimate source, but next day they can bring from wherever they want. And as per it's all a business right now, and we don't know from where they are taking, and quality of the tanker, externally it will be fully painted in a very well maintained condition, but inside there will be rusting, there will be other things, and regular monitoring is, as I told, it's almost impossible, because every day the sources are different, and they are not certifying that only from this source we are giving the water, there is no such thing as per now. And contamination from improper handling, of course it will be there. Similarly, unhygienic tanks, if it's not washed properly, means it will be having that. And lack of approval and testing. So since the monitoring is less, so approval and testing is in question. Next slide, please. Okay, sorry. So these are the tests we conducted, under the basic chemical tests and the basic microbiological testings we have conducted. First we'll go for the sample collection. So for sample collection bottle, we used PET grade 1 PET grade 1 plastic bottles, and it was washed thoroughly, disinfected with UV, and then we have rinsed with the distilled water and kept for drying. And while sample collection also, 1 liter of the suspected sample, that is, we have made sure that water is supplied by tanker only, and that water we have collected 1 liter before after rinsing the bottle in the respected samples. And first of all, we have the hardness, estimation of hardness. We have used the EDTA titration methods, and some basic methods. So these are the results we got in hardness. Like the permitted standard by that BIS standard is 200 mg. That is slightly hard, but as we can see that only the S9 sample is coming under that 200 mg. Rest all are coming above it. And if you are looking at it, S1, S5, S6, these three are the hardest of the hardest waters present. And next we have the TDS, that is the methodology is simply the weight difference method. And in that also, the BIS standard is TDS should be 500. And that's from a research paper, they are telling how much is acceptable or unacceptable. So we can see that S1, the sample S1 is 1400 mg per liter. That is highly exceeding the unacceptable value. And we also have the other samples which are extremely high. Only one is the S4 sample is in the limit, that is 500 mg per liter. Next we have done used the nice water testing kit for fluoride, chloride and residual chlorine. So fluoride, luckily there was no sign of fluoride in any of the samples, but chloride, I'll see the results, I'll show you, and residual chlorine also it was present. Fluoride, as I saw, there was no fluoride present, but chloride, the maximum limit is 250 mg per liter as per the BIS standards. But in S5, S6, S8 and S10, it has exceeded 250 mg per liter of chloride. And as per of residual chlorine, which is only found if the water is treated, we can see that S6 and S10 has some residual chlorine. But S6, it's within the limit, that is 0.2 mg per liter, but S10 it's exceeding the limit and coming in reaching in a ratio of 0.5 mg per liter. Next we have conducted range test simply for detection of heavy metals. We have not got any kind of positive results, but no deposit was there on the copper slip, but still in some samples some blackening was there. So for confirming it, we went for the ammonium monohydrate test and it became negative. So no heavy metals were present. So now going to the microbiology part, first we have done the MPN method, that is the most probable number. This say we are using this we are just letting the microorganism grow in this lactose broth, and it's actually not visible, but you can see there is a bubble here which indicates that there is some microorganism in it which is emitting this kind of gases. And next we went for the EMB plate method, in which the MPN method, the water we got from that, we have done it in a plate and we have to ground that microorganism. And then we went for the nuclear agar slants for better development of these organisms, and which was then went for the gram staining method to find out what is the organisms. And in that we could find out that S1, S4 and S7 having gram positive rods, and the rest was having gram positive cocaine. So these are the that is basically the results of this thing. So I concluded. So basically the chemical and microbiological results I have already explained, and the significance of this is that actually we need some body to analyze these kind of tanker water also, unlike we can't be ignoring that, and it can be due to two reasons: either the source is not legitimate or the tanker is not hygienic. So if the source was legitimate, we couldn't have find the hardness tedious kind of thing also. So my main conclusion is that both the source as well as the tanker both are having issues. So if you are doing for further test, individually there is a sequence of tests where we can specifically identify the bacteria. If you are going for that, we can identify which is the bacteria present, and depending on that we can check that whether it is grown inside the tanker or it's from the source. Thank you, sir.
Thank you for a good, wonderful piece of work. But my question is, if there is a regulatory board,
sir.
So in the regulatory board, this is also mentioned, like there is no source. What is the mention in the regulatory board? Ki source, where the particular vendors of these tankers will collect the water and other things. Is there any regulation or not?
No, sir. As per the I've gone through their website, and what are they saying, like the RDSWD, and they have not specifically mentioned about the source or something, but they have specifically mentioned that okay, these are whatever parameters I have concerned, and some other extra parameters they have told that the water that should be supplied should not be exceeding any of this, and they have specifically mentioned that no kind of microorganisms should be present in the water.
This is okay, but suppose if you presented this, like you are collecting the samples,
yes, sir.
Right? Have you informed them you are collecting the sample from this research? No.
No, sir.
Because we all know, na, if suppose you are presenting here, this one, if they filed a case against you for defaming him, then
sir,
how will you deal this case?
Sir, I didn't mention their name or my legitimate
Anyone,
source
na?
anywhere.
Anyone, any vendor. Suppose.
Sir, actually.
So how will you deal this kind of case?
Sir, actually, this case, if came to the notice of someone who is having the authority and power to do it, they can.
Suppose government.
Yeah.
Ultimately, government is responsible.
Yes, sir.
Right? If government filed a case,
sir,
you are blaming the government is not looking into the matter, right? Because water, this is the main thing.
Yes,
water and food. If suppose someone is not providing this, then how will you deal? What are the safety and precautions of as a researcher you should do?
So as per till now, I have not released from my source to anywhere. So basically, they can't say that I have exposed them. But taking it as a initiative, the governments can take the official permission and go for testing, and their testing can be a potential evidence.
I agree. So you should inform the concerned authority first. I am going to this research, yes,
sir.
Maybe they will provide the fresh sample. In the original picture may be different.
Yes, sir.
But we have to do the research in proper norms.
I totally agree with sir. You told that you are clearly mentioning that you don't know whether it is from a legitimate source or not.
Yes, sir.
How will you identify a legitimate source or not? We do not have that authority to do that. You should, if you inform some authority, they'll tell you if it is a legitimate or not. So it is your assumption that it might not have been taken from a legitimate source. This legitimate word itself is quite
that's my point of view. That's my opinion.
Okay.
If it was from a legitimate source, means that all the legitimate source, they are undergoing this kind of testings by RDSWD, other government officials. They are testing it continuously. Once in a year, at least they test. So.
We totally agree.
Yes, sir.
Maybe this kind of things, but we have to proper research in that, so that government will not find any case against us.
Okay, sir.
So we are disclosing the government. if we are going to just divide the samples, then you will mention the result that we are taking the sample with the leg from this row. Otherwise, it will be a problem.
Do you stay in this locality?
Actually, ma'am, my native is from Kerala, and I stay here.
From today, are you going to drink this water or not?
Of course not.
Okay, thank you.
Thank you.
Thank you. Now the next presenter is 25 ICAFS OP OF FP01. The ID is 25 ICAFS OP OF FP01.
Good afternoon, everyone. My topic is the investigation on potential uses of benzalkonium chloride (BAC) for the improvement of fingerprint development. Next. Fingerprints, as we all know, are the impressions that are formed when friction ridges come in contact with any surface, and these unique patterns are very essential in our forensic analysis for individual identification. And this fingerprint visibility and development techniques, they face a lot of, they are affected by a lot of factors such as surface characteristics, surface types, be it temperature and humidity. Say surface types, we have porous surfaces, they absorb the fingerprint residues, or the non-porous surfaces, which they don't, but they retain the fingerprint on the surface, which they're susceptible to environmental conditions and as well. Humidity, temperature, they degrade these fingerprint residues. And like these days, criminals are very clever, right? They're using a lot of cleaning agents, they're removing it. And these cleaning agents, they're like corrosive cleaning agents, can degrade the fingerprint residues a lot. But studies show the soap solutions that they have minimal impact on these on the fingerprint residues. And since there are a lot of cleaning agents, we have surface cleaners, we have floor cleaners. Ever since COVID, we are using a lot of sanitizers. In all these cleaning agents, there is this one common compound called BAC, that is benzalkonium chloride. This is a quaternary ammonium compound, which has antiseptic, antimicrobial, and preservative properties. This is found in all of these cleaning agents. Now, I am using this benzalkonium chloride to potentially use this compound to improve the fingerprint enhancement. The challenges we face usually in the case of fingerprints is the low quality prints, and even if we get the prints, we develop them. If the prints are of low quality, the detection and identification and like pinpointing an individual becomes hard. Next. My objective of the research project is to evaluate the effectiveness of benzalkonium chloride in enhancing latent fingerprints, as well as to optimize the BAC application techniques and concentration levels for the development, to also investigate the impact of BAC on different donor types, that is your strong ridge donor, your medium and weak ridge donor, and to also check the varying environmental conditions as well. Next. Methodology, we have taken fingerprint samples from 3 different donors, that is your strong ridge donor, medium ridge, and weak. All of these donors have contributed equal amount of samples so that we have balanced distribution and analysis. Next. The non-porous surface I've taken is the lab grade microscopic slide for collection of latent fingerprints, and the benzalkonium chloride I've taken is a commercial grade one. It is 50% stock solution, which I've used to make different concentration ranges from 0.1 to 3%. Next. I've used fingerprint development method as cyanoacrylate fuming method. That is the setup in which I fume the slides for 10 minutes at 120 degrees Celsius. I've maintained the humidity at 80%. Next. The fingerprints that were collected were 5 methods. First is my standard fingerprints, that is your natural fingerprints. I have not added or removed anything from these. Next, BAC treatments, the concentrations I have made, I have asked the donors to apply this BAC solution in their hand application, mimicking application of a sanitizer, and collected their fingerprints. The next one is water treated samples. I've asked the donors to wash their hands and wait till it's appropriately dried and then give the deposition. These are pre-deposition treatments. The post-deposition treatment is, when you go to a crime scene, you don't expect a criminal to do all this and deposit fingerprints. So my aim is to check if this BAC solution is improving the quality of fingerprints that have already been deposited. So I've used 2 methods, that is spraying and like dipping the slide into the solution. Next, after I've sprayed or applied this fingerprints, there are 2 different resting periods I've done. After the fingerprints were deposited, generally I left them for 10 to 12 hours before I used any development technique. And for the post-deposition treatments, that is for spray and dipping method, I've let the BAC treated slides dry in 2 types. One, after like few minutes, I've developed them. Next, the treated slides were left to dry for 24 hours to see if there's any changes. These developed fingerprints were given a score using the UK Home Office CAST scoring system, which goes from 0, that is there is no evidence of a finger mark, to 4, where very strong development and like full rich details. I've used these to organize the tables based on like no BAC's natural fingerprints, water treated prints, and BAC treated prints in different application techniques. This is the comparison of natural fingerprints and hand application and the post-treatment, post-deposition treatment ones with strong, medium, and weak fingerprint donors. This is the comparison of standards, natural fingerprints, and BAC, like different BAC concentrations in strong donor, medium donor, and weak donor. This explains that the low BAC concentrations improve the fingerprint visibility for strong and weak, while the higher concentrations reduce the improvement. And the comparison between 0.1% BAC and water treated samples, it showed that BAC 0.1% has effectively improved the fingerprint visibility, especially for medium and weak donors. And the comparison between the spray and dip method, it's shown that the dip method has improved for medium donors, while the it's same for both spray and dip are same for weak. This table, the scores have been run through ANOVA analysis, which tells that there is significant difference with using BAC versus the natural ones, indicating that the BAC concentration and application methods do influence in fingerprint visibility. With this research, I've evaluated the BAC's impact on fingerprint improvement, and which says that 0.1% BAC does help to improve the fingerprints. And the hand application, the mimicking of the sanitizer has yielded highest fingerprint clarity, but the higher concentration, that is more than 0.1%, led to diminishing results. And the ANOVA analysis also confirmed that there is significant difference, states that BAC does affect. There are few limitations which we can use, go forward and like improve them for a better results, that is to optimize the spray methods and to get an ingredient analysis to check what exactly is happening, how is the BAC reacting with the fingerprint residues, and to automate the human scoring errors. These are my references. Thank you.
Thank you for wonderful presentation. Like what I asked, you already mentioned the limitation in the research, na?
Yes, sir.
So this is the limitation.
Yes.
Only just one question I will ask.
Yes.
From my side, ki, have you taken the ethical permission?
Sir, ethical permission. I've taken permission from the donors that I am using your fingerprints for a research, and this data will be used, but I will not reveal any identity. But that's.
But have you not mentioned in the presentation?
Yes, I have taken the permission from the donors that I am collecting the data.
You should mention in the
yes,
presentation, na? Like VAC, you applied on the before giving the fingerprint, na?
Yes, sir.
So is it work in the original scene?
Sir?
In real life cases, it will work.
Sir,
is it possible to give the criminals or whatever the persons to apply BAC before?
Like I said, sir, usually if you go from a crime scene perspective, the hand application will not imply to that, but in other situations where when you're collecting samples, you can use it. While in the crime scene situations, we can improve the spray or dip methods by more research, which can improve it.
How much time you spent in this particular methodology? Like you mentioned, 10 to 12 hours for development.
No, sir. The deposition, the fingerprint, after it got deposited, I've let them rest for 10 to 12 hours.
10 to 12 hours. Is it possible in original scenario? Because suppose if you want to investigate any crime scene for fingerprint, so you will rest there for 10 to 12 hours.
No, sir. I have generally let them rest for so long. I've given it, it's not like the crime has committed and we've already gone there to collect prints. So I've given them maximum time to see. Even if it's 10 to 12 hours, we can still use BAC to improve it. That's why I let them rest for maximum number of hours.
Done from mine.
So you said you have used cyanoacrylate.
Yes,
right?
yes, ma'am.
So generally, how the fingerprints are, if they are on the wall and all, we use powder method.
Yes, yes, ma'am.
So is there any hindrance?
If we use powder method. As a part of my research, I've also tried fingerprint powder methods as well. I've used magnetic fluorescence powder. Yeah. It already gives a high, it's already a fingerprint enhancement, technique. It gave similar results to that. Already the powder is giving good enough results. The BAC ones, even for weak donors, it gave equally, good results with the fingerprint powder as well.
So you have done some comparative analysis?
Yes, ma'am. Yes, ma'am. I've done both.
Oh, thank you.
Thank you.
Thank you. Participants, kindly note the time limit for the presentation is 7 minutes. Now the next presenter is 25 ICAFS OPOF FP02. Kindly note the presenter ID 25 ICAFS OPOF FP02.
Good afternoon, everyone. My topic is development of the latent fingerprint by using the neem cake oil extract seeds. Actually, it's the alternative powder for the eco-friendly. We are using the chemical compounds for the using for the every chemical development in the latent fingerprint. Now we will move to the introduction part. As we already know, fingerprint is the unique pattern. No one has the two fingerprint in the same. Yeah, even if the same identical twins also don't have the same fingerprint. In the fingerprint is the use for the criminal investigation, for the biometric identification also we can use. For the latent fingerprints is made by the friction research that made by the sweat and the residues left by, it's not visible to the naked eye. So we can use to the powder method and dusting everything. My study is the aim and objective we will talk about. Development of the latent fingerprint by using the neem cake oil extract seed. This research aims to produce a fingerprint development powder that is the eco-friendly and cost-effective in naturally and locally easily available. So overall, neem cake fingerprint powder representing a promising avenue in the sustainable forensic development. The chemical powder, it will affect the forensic investigation person also, but in this powder does not affect the anyone. It's an antimicrobial also there in the neem cake, so it's not contaminated. The first picture represents the neem cake oil extract seed, that is the bars. The second picture represents that is the main procedures of the drying process. And the third picture is the gum magasia, it is the Arabic magasia, is used for the binding process. And next we will go to the methodology bar. Sample collection. First we need to go to the locally available in the oil stores and everything. We will collect the neem cake oil extract seed bars. Then we need to dry and grinding is the second process. To dry under the roof in the 2 or 3 days, it will help to reduce the moisture in the neem cake oil bars. So then we need to go to the grinding process. We will use the traditional grinding stone and the mortar pestle also. Then after this process, we need to move into the sieving process. It will help to reduce the size of the fingerprint powder. I was taken in the 0.125 micrometer sieves. It will the 125 micron. So the size reduction, everything we need to use the ball mill. The ball mill is the reduce the size of the fingerprint powder and add the gum agassiz also. It is help to the binding process. I already told now. But the final part is the fingerprint development. We need to collect the fingerprint in the consent from the each both male and a female person. I am taking the porous, non-porous and the semi-porous surface. These are the microscopic slide and the marble, phone display, stainless steel, paint coated cap and the steel bottle, plastic bottle and wall and wood. We will move into the result part. Also, I am attaching the pictures also. The first one is the microscopic slide. This is the non-porous surface. The fingerprint developed in the dusting method. We can see that the pattern and rich characters also. The whole pattern is detected in this microscopic slide. And then marble. It's also non-porous surface. In this non-porous also surface, we will note the pattern and everything. The fingerprint powder gave the results in the very properly. Then phone display, it's also the non-porous surface. Applying the neem cake oil powder, then after the dusting process, we will collect the fingerprint powder. Then the fingerprint development, we will detect that the porous surface and the patterns, non-porous surface and the pattern and the core and the delta, everything we can see the pictures. And then is the stainless steel with a paint coated cap. This is also non-porous surface. In this paint coated cap also we can see that the thin loop pattern is the identification in this process. The next is steel bottle. This is also non-porous surface. As you see, so many is a non-porous surface. I will continue in the porous and the semi-porous surface. The fingerprint pattern is observed and the thin loop is the observed. And the plastic case is the semi-porous surface. We can see the core and delta, that rich minute character also. The loop pattern also observed in this fingerprint pattern. And finally, I am applying the porous surface, like I am taking that the wood and the paper, walls, everything. But the porous surface, the result is not efficient to, the fingerprint pattern is not visible, it's already smudging. So in this powder is not working for the porous surface. It will give the results for the non-porous surface and the semi-porous surface. In future studies, I will give the best result to enhance the fingerprint visuality in the porous surface Actually, we need to move into the conclusion part. It's an innovative technique. So, that's the basics for the research in the fingerprint analysis. It's a conventional technique and the eco-friendly, cost-effective, and the sustainable development also we can use for this powder. And this neem cake oil extract seeds are easily available in the local. Also, we need to get. So, it will be becoming the further studies. I need to improve the limitations and the research curve. Then, what are the then here we will see that everything in the what are the developments in the fingerprints are developed under the patterns and characters, everything. My references. Thank you so much.
Thank you. It was a nice presentation. So generally you got those seeds and you crushed those seeds and you did all that by yourself?
Yeah, yes, ma'am.
Okay.
And my family members also helped.
Oh, that's what means. Okay. So under controlled conditions, no impurities?
No, ma'am. I will secure in the the drying process under the rooftop. I am safely ensure the protocol I am following. I am wearing the gloves and everything. After that only I am drying process is done. The fingerprint development also I wear the gloves and everything. The consent with the present consent and the using the feather pads, everything is properly done in the precautions. And I am done with the fingerprint is the development. This is under the control of the laboratory environment.
Okay.
Yeah.
Nice presentation. But
Thank you,
what do
sir.
you think? What are the drawbacks of the previously powder?
Sir, actually it's not work for the porous surface. I have to take out in future research in the porous surface, and the semi-porous also is moderately effective, and non-porous surface is clearly worked. And the patterns, ridge, minute characters, ridge ending and the bifurcation, dots, everything we can see that the fingerprint development pictures. So I need to improve the porous surface and water, paper, walls, everything.
Okay, thank you.
Thank you, sir.
Thank you. Now the next presenter is 25 ICAFS OP OF DFS 01. The ID is 25 ICAFS OF DFS 01.
Good afternoon, everyone. Today I am going to talk about how social media content can influence to commit cyber stalking. Next. Everyone are using social media in day-to-day life. We post videos, photos. Also we share our personal informations. How many of us know that the content we are sharing in social media may lead to become as victim of any kind of cyber crime. Here, the rise of social media significantly dual impact, as it can create opportunities for connections and as well as it can create trouble for harassments. The vast users of social media were the preliminary and the primary tools for cyber stalkers. Where the cyber stalking is nothing but the threatening, bullying, and the tracking of a person by using any kind of social media platform or digital platforms. The factors of social media content, like the lack of self-control, the lack of self-control, fear of missing out, and the anonymity features that is offered by the social media, that all can affect the behavior of cyber stalking. Yes. In methodology to analyze for this research, I have analyzed collected 200 Instagram samples of by following certain parameters like where the profile type is public or private, age group, gender, and the post type, location tags, hashtags, etc. Where in public profiles, I have taken 120 of public accounts and 80 of private accounts. In 120 public accounts, I have divided into vloggers, content creators, influencers, meme channels, and also general public users. And in age group, it is distributed as 15 to 20 years of 11 samples, 20 to 25 years of 70 samples, 25 to 30 years of 94 samples, and 30 to 35 years of 25 samples. And also on the basis of gender, I have taken 117 of male samples and 83 of female samples. For analysis, I am using it is basically on the content analysis. So the statistical analysis that I have taken is descriptive data analysis and MONOVA test. Where in descriptive data analysis, we use independent variables for to analyze the content and the pattern of engagement matrices in sight of behavior potential for cyber stalking vulnerabilities. When in MONOVA test, we used to analyze the differences between the potential and the demographic factors and engagement level between them. And it is basically on the multivariate dependent analysis. In result part, for descriptive data analysis, this is of descriptive data analysis where it includes of measure of central tendency and measure of dispersion. We can analyze by calculating mean, mode, median, as well as standard deviation, range, and variance of all 200 Instagram profiles of independent variables. Where it comes to dependent variables, where we can see the graph of like where it in the frequency of followers, which is there less and which can be more than 2 millions, that leads to the digital exposures, and it can be the that will be more vulnerable to. When it comes to the number of posts that I have taken for the 1 month period of analyzing for 1 month period, where we can see there one or two profiles have shared more than 500 posts in a period of 1 month. That may leads to digital exposure, leads to more digital exposures, and it is also can lead to the vulnerability in comes to cyber stalking. Then location tagging. In location tagging, the more we tag our real-time locations, the more we are exposing ourselves. And when it comes to hashtag, the hashtag is based on basically works on the algorithms, where we can see the each profile has having different number of algorithm used, where the more number of algorithm that we used, that may become us to expose ourselves more. When it comes to engagement matrix, the likes, comments, and shares, when it comes to a more number of followers and number of posts, the number of engagement matrix will also be the more. This is also a MONOVA test analysis where it comes to profile type, age group, and for gender and post type. When it comes to profile type, public profiles are more vulnerable as compared to the private accounts. When it comes to age group, the young users of 20 to 25 years is more vulnerable, more exposing themselves in place of social media. When it comes to gender, females are exposing themselves more, like engaging themselves more in social media, that leads them in knowing themselves. Then the limitation of this research is the sample size is taken only 200. When it comes to the more number of samples, the results may be changed based on the parameters that we are taken, and also the parameters may differ for various platforms, where I have taken only Instagram profiles. When it comes to other platforms like Snapchat, Facebook and all, the parameters may change, and the vulnerabilities of exposing themselves also change. Conclusions: when the social media content significantly influence the cyber stalking risk. When it comes to fear of missing out, cyber stalking vulnerabilities, the social impacts and psychological impacts affect on their lead to anxiety and depression. To mitigate this, we can increase the awareness, and we can strict our privacy settings. We have to be responsible for our digital behavior as well. These are the references that I have taken. Thank you.
Thank you. I have just only 2 questions. Please explain, because already you are taking too much time. So what is the outcome of your project, and how would you identify that this profile is original or not the fake one?
I have taken the permission with a genuine profile. I have not taken any fake profiles with
that
the permission.
Profile is genuine?
With their permissions. With their permission for private as well as for public. I have taken the permission with the privacy and confidentiality, and I have for the analysis, content analysis.
And the outcome?
Outcome is to how much we are exposing them ourselves, and how much we have to reduce the exposure of the content. What are all the content that may lead us to being a victim of a cyber crime?
Hello. So, how do you prefer to regulate? How do you prefer to regulate this cyber stalking? What, according to you, can be done?
Cyber stalking is not a major cyber crime, but it is a basic cyber crime that leads to other cyber crimes like cyber harassment, bullying and all. That basic of this, if we want to do any cyber, like if criminals want to do any cyber crime, the basic, they have to take some their informations. For that, they use cyber stalking methods. They will stalk themselves without knowing the person.
That's what. Do you think that it can be regulated?
Yes, ma'am.
As you only told, fear of missing out, FOMO.
Yes.
It affects each and every Gen Z kid nowadays.
Yes, ma'am. Because of experiencing of rewarding offers, they are fearing that where we will miss out that. And the likes, comments, shares that they are getting, that will make them to expose themselves more when it comes to Instagram and Snapchat.
Okay, thank you.
Thank you.
Thank you. Now we move on to the next participant. The ID is 25 ICAFS OPOF DFS 02. The ID is 25 ICAFS OPOF DFS 02.
Good afternoon, everyone. So my topic is multivariate analysis in forensic approaches to tackling fake cryptocurrencies and valuation fraud. So cryptocurrency is a digital money which exists only in the internet. Without internet, we can't do that. And it is a decentralized system, use blockchain, which every blockchain uses a unique hash value when the transactions are done. And transactions are done with security and transparency. To maintain that, we have some using blockchain technology, we will be having some values that every transaction will be valuated, and we'll be using for like cryptocurrencies are growing and bringing some innovation, but at the same time it brings vulnerabilities, risk that could be valuation fraud, counterfeit digital currencies, and illegal financial activities. Objectives are to compare price trends and fluctuations, that is for so-called cryptocurrencies and conventional cryptocurrencies, to investigate speculative trading, supply manipulation and fraud schemes, and to analyze some third-party applications which are used to manipulate some of the cryptocurrencies that could be vulnerable due to permission granting and all. And for regulatory purpose, for methodology, we have used like 3 methods: time series analysis, principal component analysis, and regression model. In time series analysis, we identify the pattern of cryptocurrencies which are used. For conventional, it will be stabilized cryptocurrencies, but in so-called cryptocurrencies, it could be like Dogecoins, Shiba Inu, cryptocurrencies which are manipulated by celebrity endorsements and any social media influencers. It could be manipulated. In principal component analysis, we distinguish with the characteristics of the cryptocurrency, whether it is using blockchain technology or it is manipulated by any speculative manipulation, everything. In regression models, we'll be noticing the trading activities which are going on, and fake promotions and social media influence, using any social media, some influences that tell that it will be rising, so you can buy that. Then it will lead to mislead advertisements and celebrity endorsements. In X, that is called Twitter, Elon Musk regularly says that Dogecoin will be growing stage, it will be going, then it will be growing. When he says no value for Dogecoin, it will be depressing in that. And I have collected the data from 3 of the websites, that is CoinGoica, CoinMarketCap, and CoinDCX. These are the conventional cryptocurrencies and so-called cryptocurrencies. I have used 5 samples each for that: Bitcoin, Ethereum, and Binance Coin, Ripple, Cardano, Dogecoin, Shiba Inu, Floki Inu, Pepe, and Bonk coins. They are called so-called cryptocurrencies. In data analysis and key findings, I have found out that they use pump and dump schemes which are probably regulated by influencers. It could be celebrity endorsements by social media influencers. In security risk and in crypto transaction, they use third-party applications that could be, they can ask some permissions like microphones, files, data, and all. There it could be data breach using these apps. And market trends and fraudulent activities, comparison of conventional and so-called cryptocurrencies. You can see in conventional cryptocurrencies, they will be stable and valuated, that chart will be going easily and it will be not manipulative. But in so-called cryptocurrencies, it will be social media driven, that could be manipulated. Whenever the stock price goes down, up, it will be manipulated. In wash trading indicators, fake liquidity that can be shown. that buyer can repeatedly sell and buy to increase the volume of the cryptocurrency. Unusual spikes can be seen in no real market demand if the influencers or any endorsements can be motivate or influences any Dogecoin or any of the so-called cryptocurrency. It could rise or it can go down. Regression model results. In this, we have speculative analysis we have done. We have got crypto valuations, that is Ponzi-like schemes that could be going on. Ponzi schemes are like promoting and giving the 100% return valuation, but it is not. In machine learning models, we can detect also that fraud detection. In conclusion, cryptocurrencies are highly susceptible to valuation fraud and manipulation. Forensic techniques help detect fraudulent trends and improve security. Regulatory interventions are necessary for investor protection. Future research can be AI-driven, that could be machine learning, bringing smart contracts into the picture. And these are my references. Thank you.
Thank you. Wonderful piece of work. What is new in this? What is new in your research? Is there any new thing? Because these techniques are already used.
No, sir. In valuation fraud, we haven't used that third-party applications which are vulnerable to data theft and data breach. Only this paper, I'm working on that now. So only in this data breach and valuation fraud has been introduced newly. In other papers, only they have shown that only for particular like Bitcoin, Ethereum, Shiba Inu or Dogecoin kind of things.
So you said social media influencers influence the trend.
Yeah.
Everybody, all of us, they believe them, right? Social media.
Yeah, some of them believe, some of them ignores.
No. Not some, majority of them.
Yeah.
Majority of them. So there should be some regulations for that, right?
Yes.
So have you focused on that? Do you tend to focus on the regulatory aspects of this cryptocurrency, because this is very new to us?
Yes.
And the government is of course introducing bills and all for this cryptocurrency. Have you heard about PiCoin?
Yes, ma'am. I have heard of PiCoin.
What exactly does it do?
It doesn't work on blockchain, but it works on the social media influences only.
Yes. Nee, as you told, see, Trump has introduced a recent, and his wife introduced a coin.
Yes.
Right? Before Trump, his wife introduced, and that the prices were too high. Suddenly,
one more coin came, ma'am, WorldCoin. They are also taking the iris scan, and data theft has been done in that also. And in some of the applications, they are using files, data, and photos, microphone. That is not needed for any kind of mining or a kind of permissions they are asking in that.
PiCoin does, it can be done in our phone itself, right?
Yeah, ma'am.
PiCoin gives the access to mine in our phone.
Yes, every access will be taken in that app.
That's what. So this is all it is a very wonderful, novel issue. I totally agree with sir. It is very nice piece of work, but it can be, it can take it to other level in future.
Yes.
That's what, it is very important. Nothing related to cryptocurrency. And this Bitcoin itself was before, I think so in 2016 or 17, it was only 50K. Now it is nearly
1 crore. 1 crore, near to 1 crore, yes.
So that's what. You said these are conventional and
that is because of speculative manipulation, ma'am. And one more thing, buying and selling of cryptocurrencies, that unique hash value will be increasing day by day. That causes the increase in price, because it is a manageable point of kind of blockchain technology that is used.
Okay. The future, as Elon Musk itself says,
Dogecoin will be increasing.
By exchange of a Bitcoin. So this technology, this is very novel thing. All the very best for your future.
Thank you.
Thank you. Now the next presentation is from the presenter with paper ID 25 ICAFS OPOF FPSY01. Kindly note the ID is 25 ICAFS OPOF FPSY01.
Good afternoon, one and all. I hope you guys are not bored till now. I know it's a lunch time, but still. Okay. My topic is of the burden of differences. Examining the psychological consequences of ethnic and linguistic discrimination in India. Everyone spoke about the latest technologies and latest issues which going on right now, but still no one doesn't care about what the existing problem is already there in India. So my study focused mostly on the discriminations based on ethnic and linguistics. Yeah, my research contents are the introductions there. I will be talking about the objectives, methodologies, psychological impact, coping mechanisms, and etc. etc. We'll be seeing on the upcoming slides. Yeah, let's have an introduction about what actually I'm going to speak about. As we know, India is known for its diversity. Like we have multiple cultures, languages we use, different kind of people, and so on. There are around 1,600 languages spoken in India, but we know only one or two, like mostly literally 5, maximum 5 to 6 languages we are aware of. But still in India there are 1,600 languages, even the same languages have different dialects, and out of which we only 22 languages are officially recognized, which is less. But still in future we can have many more languages to be recognized. And then let's just talk about the part of discrimination. What exactly is discrimination? Like when we spot someone different from us, we start to discriminate. Not only for my topic, but still discrimination, it's a huge issue. Let's say in a group of 10 peoples, everyone wears a blazer and a top suit. Suddenly they spot a guy with just a t-shirt or shorts. They suddenly start to discriminate him for his looks. Similarly, many scenarios are there, but the level of discrimination, it matters. Now, in this, people are getting discriminated for their languages and the ethnicity. One of my participants has also said that language is not just a means of communication, it is who we are. When we deny the value of our language, it feels like denial of our own identity. Let's say the language which I speak, if you don't speak my language, I started to discriminate you because it doesn't connect us both. Even though it's just a means of communication, but still we started to believe if you don't speak my language, I won't connect with you, I don't value you. It doesn't matter how valuable person you are, I just ignore you. And the main objectives of the research is the psychological consequences of ethnic linguistic discrimination. And then the main methodology which I used is the mixed method of approach, where I took qualitative data as same as the quantitative and as same as qualitative. For quantitative, I took a survey of around 100 participants across the India, where they have either witnessed the discrimination or being in the part of the discrimination or faced the discrimination. Along with that, for the qualitative purpose, I also took the 35 the 35 participant in-depth interviews where they even shared their experiences, where different scenarios where they actually like felt discriminated. Since it's a sensitive topic, I have also considered the ethical consideration. I also took the consent from them, so that I don't have any issues later. The participants are mostly from the southern region. You can see this. I have listed the states along with that. And then what exactly the psychological impact people are facing? First is the mental health outcomes. They come with chronic stress disorders, PTSDs, low self-esteem. Mostly people lost their confidence once they get discriminated, and they have anxiety and depression statistics. Nowadays, depression is just like a fashionable term. It doesn't matter what, even they are not aware of what exactly is depression, but still people are think, bro, I'm just depressed because this guy said me something. I will be depressed for a week. I will just put on the status something, just go on. And then identity crisis. This is the huge thing, because if people don't recognize who you are, you started to self-doubt yourself. If someone asks you, where are you from, you will say so and so, but still after so many kind of discrimination, you are not sure about whether to say the real truth or not. Instead of saying your own identity, you just borrow someone's identity. Let's say I am from Tamil Nadu. Instead of saying Tamil Nadu, I will start to say I am from Bengaluru. So that it's just when people think, okay, he's from Bangalore, so he knows Kannada, something like that. And then the pyramid of the most people having the social withdrawals after discriminate, they just isolate themselves from the peoples, and identity crisis 52%, and increased anxiety and depressions. And then there are multiple coping mechanisms which people undergo. Most common is seeking social support. It's not there actually. People don't want to seek support because they don't want to share. Because they are not sure whether the person who is listening will be empathize with him or not, or else they will just tease him. Okay, he's just crying something. We will just leave him alone. And then ignoring personal feelings, becoming aggressive towards others. This is the main issue we are talking about. Let's say I am discriminated more and more. So what I do is, instead of being the victim, I started to discriminate other. Because it happens to me, so I will follow the same thing. Instead of being the victim, I will be the perpetrator. The forms and places of discrimination. What are the common forms of discrimination? Verbal abuse, exclusion, denial of opportunities, stereotyping, hate comments, limitation of access. And the different places will be like institution, even in educational institution, there are many discrimination going on, but no one stood to talk about it. And the public places, residential areas, social medias, this is the wide area. Because your identity is not revealed, so you will be like, chalo boli dete hain kuch bhi, that thing. The working environments. Now, let's see the possible consequences because of these things. Now, if we, the main is conclusion is the possible consequences because of these things. Let's see, if we spoke about the labeling theory, people consider themselves as the outsiders or backwards. They don't stick to the peoples. The conflict theory, ethnic and linguistic conflicts, regional tensions. Let's say Hindi versus regional languages, they are like imposed on them. And the social disorganization theory. If people are getting separated from the society, they started to commit crime. And the strain theory. Discriminated community like particularly faces the poverty, unemployment, because since you are getting denied with your opportunities, so they started to commit more crimes. And the psychological theories, social identity theory, I hope the time is gone, so I will just skip it. Yeah. The most conclusion is there are so many people in my participant, out of 100 participants, more than 75% of the population faces this discrimination. So they are going to so many psychological disorders, and which may tend to commit more crimes. My references. Thank you. Yeah. Yeah. Yeah, government is support.
If you are not meeting with the like council and other things, this is the failure of the participants.
Yes.
Government is discriminating, then maybe there will be a question, na? Because they are appointing counselor, whether in the universities, education sector, health sector, even the corporate companies. Now this is like mandatory. So how will we discuss like all these things?
There are people who we can consult, but how many people do you think practically they are going to the counselors?
That's what sir said, that it is a failure of a participant.
Okay. But still, out of 100, 75 participants are facing this issue, right? Even it's a failure, I accept it, but still.
Okay, thank you.
Thank you, sir.
Thank you. As we come to the conclusion of the session, I take this opportunity to express our heartfelt gratitude to all the presenters for their insightful contributions, which have added immense value to this academic discourse. A special note of appreciation goes to our esteemed chairpersons for their time, expertise, and valuable guidance throughout the session. Your presence and insights have truly elevated the discussions. Thank you, Sir and Ma'am. On behalf of ICAFS 2025, I extend my sincere appreciation to the organizing committee, technical team, and all participants for their unwavering support in making this session a success. With this, we conclude the oral presentation session. We will begin with the technical session 5 after the lunch break. The next session will be on the role of behavioral science in forensic investigations by Professor Teresa Guzman, University of Philippines, Manila. Thank you. Now a kind announcement. Delegates, please note that the lunch will be served in the staff pantry, first floor admin block. Our student volunteers will be guiding you for the venue.
Good afternoon to all esteemed dignitaries, distinguished speakers, and delegates present here at ICAFS 2025. As we progress through day 2 of this prestigious conference, we now turn our attention to a crucial yet often unexplored dimension of forensic investigation, behavioral science and its role in criminal analysis, suspect profiling, and investigative psychology. Understanding human behavior, cognitive processes, and psychological patterns is essential in criminal investigations, aiding in offender profiling, witness assessment, deception detection, and courtroom decision making. The intersection of behavioral science and forensic science has led to significant advancements in investigative strategies, crime prevention, and the administration of justice. To provide us with a comprehensive understanding of this subject, we are honored to have with us a distinguished expert in forensic psychology, behavioral analysis, and criminology, Professor Teresa G. De Guzman. Professor Teresa Guzman is an esteemed forensic psychologist and academician, currently serving as a professor of behavioral science at the University of Philippines, Manila. With over 2 decades of experience in criminal psychology, forensic behavioral analysis, and investigative interviewing, she has worked extensively on criminal profiling, deception detection, and psychological assessments in forensic casework. Professor Guzman has been actively involved in law enforcement training programs, collaborating with police departments, legal institutions, and forensic laboratories to integrate behavioral science methodologies into investigative procedures. She has also contributed significantly to research on psychopathy, interrogation techniques, cognitive biasness in criminal investigations, and behavioral indicators of deception, with her work being published in leading forensic psychology journals. Beyond academia, Professor Guzman has been a consultant for criminal justice agencies, specializing in suspect profile, suspect behavioral assessment, witness credibility evaluation, and jury decision-making processes. Her expertise in psychological forensic and investigative science make her a key thought leader in modern forensic investigation, bridging the gap between criminal behavioral analysis and forensic case resolution. It is a truly privilege to have such an accomplished scholar and practitioner with us today. Now, without further delay, I request Dr. Guzman to deliver her technical address.
Okay, can you hear me? Can you hear me?
Yes, ma'am, we can hear you.
So I can start now, no? Good evening, everybody. It's almost 5:30 here in the Philippines, and good evening, students. Kristu Jayanti College, and I'm so privileged to present our discipline from the Department of Behavioral Sciences, and of course, from the College of Arts and Sciences, University of the Philippines, Manila. And it's I'm honored to present the role of the behavioral science in community-based forensic investigation in the Global South. Forensic investigation in Global South present a unique challenges due to historical injustices. And we all know when you say Global South, some technologies are deficient. Sociopolitical instability and limited forensic infrastructure, specifically in the Philippines. To navigate these complexities, behavioral science, particularly anthropology, ethnoarchaeology, which is also different from archaeology, provides critical insights. By understanding the behavior, cultural practices, trauma responses, and forensic experts can develop ethical and community-based centered methodologies to support the justice and human rights efforts. So anthropology and ethnoarchaeology and forensic science are essential disciplines, because in our department, we have different disciplines. And when you say behavioral sciences, we have the psychology, archaeology, linguistics, ethnoarchaeology. Forensic is now, actually, we're offering forensic now. And of course, we have psychology and sociology. So the essential of these disciplines within the behavioral sciences examines the human behavior, societal issues, cultural tradition, and societal changes over time. So in forensic investigation, this is very crucial. These disciplines help us interpret the skeletal remains, the burial practices, cultural attitudes towards death and justice. At the same time, when you say linguistics, we have different meanings, different terminologies, like the one that the speaker told, that languages can also understanding language can benefit in order to understand what is the meaning of death and justice in a particular community. At the same time, indigenous knowledge and oral history also play a vital role in reconstructing past events, in identifying victims and violence and disasters. Actually, we all, as a linguist, also ethnolinguistic, I do work on in different ethnolinguistic groups. We also define what is the meaning of violence based on the perspective of the different communities. We also discuss, and also part of the cultural construction as also the definition of violence in different communities. So what is forensic archaeology? No? Sometimes we use ethnoarchaeology because we are also considering the participation of the community. That's why it's ethnoarchaeology. And we use the multidisciplinary approach and interdisciplinary, excuse me. In Global South faces the different challenges, especially in the Philippines, especially on forensic investigation. Why? Because limited forensic infrastructures and resources. That's why we tend to collaborate with the different countries in order to suffice this kind of investigation. Political instability, corruption is also a reason for potential obstruct justice. You know, the status of the Philippines is it's in the media now. And historical injustices like colonial violation, specifically in Africa, there's apartheid, decolonization, and so on and so forth. And the state-led disappearances create mistrust and in legal institutions, specifically among the police here in the Philippines and other Global South. Another issue is the geographical isolation. In many communities, access to forensic experts is a scarcity because of the geographically isolated places, location of this community. What is forensic anthropology? It's another specialized disciplines under the behavioral sciences here in Department of Behavioral Sciences in UP Manila. Of course, most of the time they are in charge in the mass disaster, especially integrating the biological assessment of the victims, integrating with osteology and other disciplines. So what are the different challenges, especially in the Global South? Okay, mind the gap. We have gaps specifically in Global South, and particularly in the Philippines. That's why we are using participatory forensic approaches in order to understand the different cases in the Philippines. To address these challenges, we use community-based forensic. When you say community-based, it's we are more sensitive, and it is crucial to respect and integrate the local knowledge systems and culture beliefs into forensic work. Another, we are engaging with the communities in the process of evidence recovery and interpretation. Together with the community, sometimes this is very crucial in doing an investigation in a crime scene. Why is that so? We need to inform the community not to contaminate the forensic or the evidences in that particular crime scene. We are also addressing crimes such as the mass violence, disappearance, and historical injustices through participatory methods like interviewing people within that community. By incorporating the local perspectives, forensic experts can now foster trust and ensure that investigations serve the affected communities. Significance of this criminal investigation and justice, it is also critical in identifying individuals in like mass disaster and humanitarian cases. In my discipline, I am more into heritage forensic also, identifying the different artifacts of those victims, especially in mass burials, okay? In order for us to identify their social demographic profile, their culture, and of course, the environment. We use this kind of practices and techniques in order to give profile to that disease. Another, we also tend to use this collaboration in understanding the different trauma patterns, especially the time of death. And behavioral scientists also can help law enforcement in solving complex, especially the complex cases like DVI or disaster victim investigation. It helps bring justice to victims and, of course, closure to the family. So what are those, the so-called disaster victim investigation? Okay, of course, if you're using multidisciplinary approach, use the forensic anthropology to profile the remains. And of course, what are the different trauma? What is the difference between the forensic pathologists and anthropologists? Pathologists, they tend to dissect with the flesh, but for the anthropologists, we're focusing more on the trauma based on the bones. Okay, so these are the anatomical remains. Why is it important? Because when you say multidisciplinary, not just for the pathologists, we are also working with the biologists, radiologists, to ensure rigorous scientific accuracy of the cases. So what are those ethical consideration? Of course, we need to do different methodologies. I hope you're familiar with the different ethical consideration and methodologies used within the Global South specifically. One specific important thing is the social value. What is social value? It is more on the understanding and improving the closure for, and of course, to protect the well-being of the individuals. And social value requires dissemination in the community, not the details of the forensic scientists, but more on the details. What are the causes of death of the unidentified individuals? So what are the methods? We use participatory research, which is culturally sensitive. Not all societies are the same. I'm sorry, not all societies are the same. So there's a specific method that we use in different societies, okay, to ensure that investigation is ethical, and also protects the participants' rights. In protecting human rights, we use this, of course, the different ethical methods. One, ethical concerns, the privacy, rights, and the welfare. Of course, prior to the investigation, we do different strategies, specifically among the indigenous group. There's a specific ritual prior to investigation. Okay, not just being transparent to the community. Here in the Philippines, specifically among the indigenous group, we are also transparent with, of course, with the existing protocol or traditions of the community. Okay, so most likely these are the spirits, environmental spirits in the community. So there's an informed consent to people, and of course the spirits in existing in the society. Okay, so when you say informed consent, of course, ensuring that the informants and participants understand the purpose, the procedures, and of course the potential dangers and benefits in doing the investigation. The purpose, of course, is to minimize harm. So what usually the technique that we are using the verbal autopsy. Okay, this is the skill of the behavioral scientists, because we are loaded with sociology, archaeology, linguistics, and so on and so forth, anthropology, of course, and psychology. Okay, and of course, when you say verbal autopsy, usually we use this method in disaster victim investigation in a mass burial sites, okay, especially during the Haiyan event that happened in the Philippines. So when you say verbal autopsy, it's more of the disaster response, okay? Reconstruct the site, reconstruct the heritage, reconstruct the environment, and of course, reconstruct the identity based on the remaining artifacts of those victims. In conflict zones, we also use this, interviewing people, okay? In public health, we use this, the mortality patterns, of course, in allocation leading to causes of, in interviewing to support the policy making by identifying the leading causes of death in a specific community or society. So what are the benefits of verbal autopsy? Okay, it captures broader understanding of death, provides cultural and familiar context. What is the definition of death among this community? Life after death? Or there's in some societies, in some indigenous communities, there are rituals in order for them to transfer from another life. It is also, when you say verbal autopsy, we can also facilitate closure to families, acknowledging their input in the investigative process. What are the ethical considerations, especially in the Philippines? There are a lot of cases, AGK, I hope you're familiar with that, extrajudicial killing. You cannot just use remains of the individuals, especially using skeletal remains in educational purposes. That's illegal here, and of course, illegal in other countries. Okay? You should have or obtain permission coming from the community and also the family. Like, for example, in the Philippines, there are a lot of looted remains. These are samples of remains in the Philippines in a different community, one of the Afro-linguistic group in the Philippines. Prior to investigation, prior to getting samples, we need to conduct rituals, okay, prior to investigation and after investigation. So we have to appease the spirits also, not just the community. Okay, if you don't do that, if you don't practice rituals, there are some, well, traditions, probably accident will happen to the researcher or investigator or even in the community. So what are the challenges, especially who has the right to access if there are, reconstruction of those informations that was taken from the community? Like, for example, in digital evidences, we cannot just publish these faces, especially using this 3D imaging virtual autopsy, okay? Because there are some biases that it can duplicate, and some of the people can use that specific face in the internet. Another, the body forms, I doubt, because in the Philippines, almost 98% are Catholic, and we prohibit this body form, which is very crucial, especially in understanding and reconstructing the time of death, probably, or the process of decaying and other process of the death, okay? Because in the Philippines, dignity is very important and the religious concerns are very important. So we balance the ethics, we use transparency, ensure open communication about how remains and data are used. Training and education, we train forensic behavioral scientists and anthropologists and other professionals in ethical guidelines. We do this. And of course, lastly, we engage the community and the stakeholders to bring the policies, of course, to have these policies and respect their decisions about the case. So we trust building and collaboration is important in the community. Okay? Forensic investigation cannot succeed without the trust building and collaboration. What are the approaches that we use? Participatory research, empowering the communities and allow them to take active action in seeking justice. We have to be open, transparent to the community, especially those affected communities with disaster or DPIs. This time in participatory research, we involve community members in the forensic process, whenever possible. And of course, in collaboration, interdisciplinary experts, including the psychologists and other experts coming from India and other countries, legal professionals, human rights organizations to interpret those cases. Challenges, of course, leveraging the technology. You are in India, you're much advanced here in the Philippines. Challenges, it's expensive, of course, the technology. That's why some of the members of the department are doing trainings in India. Ethical dilemmas, we can provide those because we are capacitated by different disciplines, and of course, the legal consideration. So we work as a team, not just an individual as individual forensic scientist. Integration, strengthening the collaboration is important because integration of diverse expertise, much more information, encouraging, of course, different methodologies, and reducing miscommunication and misinterpretation. Challenges in collaboration, conflicts over priorities. There are some disciplines that has this conflict, especially the preservation, the archaeologists sometimes, or versus the forensic investigators. Solution, regular, interdisciplinary, multidisciplinary. If you want to involve the community, it's transdisciplinary, and have this clear protocol for evidence collection to minimize conflict. Benefits of collaboration, holistic, enhance reliability, and public trust. Okay, so you can see the picture. Most of the time, they're in India, participating ISR and other conferences there in India. Okay, so It's more an effective collaboration with the other experts. And it's opportunity for us to grow. Okay? Global collaboration is important because it's advances in communication technology, innovative research direction, like for example, AI. Here, we are just starting, especially the AI. Some of the faculty are now requesting program for AI in order to identify plagiarism or using AI for the research papers for the students and the policy. Okay, so we have to do this robust framework in managing the ethical and legal challenges. In conclusion, forensic behavioral science is particularly anthropology, ethnoarchaeology plays a vital role in forensic investigation. Especially in the global south, like our countries, India, Philippines, by incorporating specifically the community-based approaches of the forensic experts can navigate complex socio-political landscape, empower affected population, contribute to pursuit of truth and justice. And for us, forensic behavioral sciences, it is a tool for advocacy, reconciliation, and human rights. And of course, for future work, we must continue to do and consider the ethical and participatory methods for us to have an understanding which is different from the global north, because we're more sensitive with the culture and language, and of course, the sensitivity of the community. That's all. Thank you. If you have questions, you can ask questions. Thank you very much for this invitation. Back to you.
Thank you, ma'am, for the insightful presentation. We will now open the session for questions. Delegates, please raise your hands if you have any questions, and we will pass the microphone to you. Online participants can send their questions through the chat box. On behalf of ICAFS 2025, I extend our deepest gratitude to Professor Teresa Guzman for delivering such an insightful session on the role of behavioral science in forensic investigations. Your expertise in forensic psychology, investigative behavioral analysis, and crime profiling has provided us with invaluable perspectives on how behavioral science enhances forensic methodologies and contributes to criminal justice systems worldwide. We are truly grateful for your time and expertise. Thank you once again for gracing us with your presence and for your valuable contribution to this event. We look forward to more opportunities to learn from you in the future. Thank you, ma'am.
Thank you so much. Thank you so much for that. And hello, students.
With this, we conclude technical session 5 of ICAPS 2025. We will now proceed to the validatory ceremony of ICAPS 2025.
Good evening and welcome back everyone. As we bring this conference to a close, it is evident that the 2 days discussions have been invaluable in deepening our understanding of the complex journey from crime scene investigations to the courtroom. We had the privilege of hearing from esteemed experts including Dr. Rukmani Krishnamurthy, Dr. Vandana Vinayak, Dr. Lata Gautam, Dr. Pramod Bagli, Dr. Ankit Srivatsava and Professor Teresa Guzman, who shared their expertise on forensic investigation, legal perspectives, and the role of forensic science in the justice system. Their insights have not only illuminated the evolving challenges in the field, but also highlighted the importance of interdisciplinary collaboration between forensic scientists, law enforcement officers, and even legal professionals. The International Conference on Advances in Forensic Science brought together 101 delegates online and offline from 30 different esteemed institutions across the country, including a mix of students and working professionals. This diverse assembly aimed to address critical issues in criminal justice system. Now, I invite a few external participants to share their feedback regarding their experience in this conference. I invite Ms. Sana Sheikh, Assistant Professor, Department of Chemistry, Ram Narayan Ria Autonomous College, Mumbai, to give their valuable feedback.
A very good evening, all of you. As an assistant professor of chemistry, attending an international conference on advances in forensic science was a remarkable experience. The conference was well organized. I have visited this college for the first time, and I must say that Kristu Jayanti Autonomous College, you people are doing a wonderful job in maintaining the academic excellence and fostering innovation and research. I express my heartfelt gratitude to all the faculty members who were instrumental in organizing this conference. All the sessions that we have attended by the eminent experts in the field were very much insightful, enriching, thought-provoking, and engaging. And we look forward to attending such enriching sessions in future as well. So thank you so much for giving us this opportunity to enhance our knowledge and present our research findings in the field of forensics. Thank you.
Now I invite Ms. Sanchita Ahir, DFSL Mumbai, to give their valuable feedback.
Thank you, Devi ma'am. Good evening, everyone. Myself, Sanchita Ahir, and currently I'm working as fact professional in DFSL Mumbai. So coming for the conference was very relatable. Like we had our eminent keynote speaker, Dr. Rukmani Krishnamurthy ma'am, who was the ex-director of DFSL as well as who started the Institute of Forensic Science in Mumbai, Aurangabad and Nagpur. Then now also I came to know Mrs. Professor Manashri Mane ma'am is also our alumni from the IFSC Mumbai. And then few of my colleagues like Mayank sir and Neha ma'am, they are also my classmates and seniors. So yes, attending the sessions of all the eminent speakers like Rukmini ma'am, then Ankit sir, Vandana ma'am, Pramod sir, Teresa ma'am was really enriching to enhance my knowledge, which will be useful for my future career as well. I thank to the principal of Kristu Jayanti College for having this. So like they are doing really great to the HOD of the department, all the faculty members and the volunteers who have given us a really great hospitality throughout from the registration of the conference until now as well. Thank you so much.
Thank you, dear delegates. Your feedback means a lot to us. As we move forward, it is essential that we continue to strengthen these collaborations, adopt cutting-edge technologies, and promote knowledge sharing to ensure justice is served efficiently and accurately. Let this conference be a catalyst for continued progress in the forensic science and legal domain. One of our major highlights of our conference was the insightful oral and poster presentations that we had. We had a total of 87 presenters through online mode as well as offline mode with a diverse range of research interests. I take this opportunity to award the best oral and poster presentations. To give away the best oral presentation award, I call upon Dr. Ankit Srivatsava sir on stage. So please, sir. The best oral presentation in the field of forensic chemistry and toxicology goes to participant ID number 25 ICAFS OPOF FP01, an investigation on the potential uses of belcanol chloride for the improvement of fingerprint development by Manjula Srivalli from Christ University. Thank you, sir. Now the other awardings for best oral presentations are from the online presenters. The best oral presentation in forensic biology, medicine and anthropology field goes to 25 ICAFS OPON FB01. The topic was detection of saliva and different fabrics at various temperatures and concentration, ABO blood grouping and microbial growth analysis from dried saliva stains by Karthik Kashyap KH from Christ University. So for online presenters, we'll be giving the soft copy of your certificate. The best oral presentation in fingerprint and question documents goes to 25 ICAFS OPON QD01, chemometrics assisted characterization and discrimination of printing inks and toners using ATR FTIR spectroscopy by Anjali Tomar from Institute of Forensic Science Criminology, Punjab University. The best oral presentation in digital forensics category goes to 25 ICAFS OPON DFS 01, evaluation of voice recognition tools with diverse voice samples, a comparative study by Ashwati Chandran. And the best oral presentation in forensic physics category goes to 25 ICAFS OPON FPHY01, soil mapping with physical and chemical properties for forensic application, soil data bank by Badra K from Christ University. Now moving on to best poster presentation award in various categories. I request Dr. Bhavna Desai to come on stage to give the best poster presentation award. Ma'am, please. The best poster presentation award in forensic chemistry field goes to 25 ICAFS PP OFFCT 06, isolation and identification of date rape drugs from biological and non-biological matrices, a systematic review by Kavya Priyal L from Kristu Jayanti College, Bangalore. Thank you, ma'am. Now I invite Dr. Manishri Mani to give away the best poster presentation in forensic biology field. The best poster presentation award in forensic biology, medicine and anthropology goes to 25 ICAFS PP 0F FB04, detection of pollen adherence of fabrics using microscopy by Gunashri BS, Kristu Jayanti College, Bangalore. Thank you, ma'am. Now I invite Mr. Don Cairo, Head Department of Forensic Science, Kristu Jayanti College, Bangalore, to give away the Best Poster Presentation Award. The Best Poster Presentation Award in Fingerprint and Question Document goes to 25 ICAFS PPOF QD01, Determination of Sequence of Strokes Using Optical Profilometer by Malavika Palukir, Christ University, Bangalore. Thank you, sir. And the last Best Poster Paper Presentation Award in DFS category, Digital Forensic Science category, goes to 25 ICAFS PPOF DFS 01, Cryptography in Digital Forensics by Likita C. Jain from Karnataka Science College, Dharwad. Congratulations to all the winners. A special word of appreciation to all those who have presented in this conference. You may have not won a prize, but you have given your best when you choose to present your findings, and we are sure it will move you to greater heights when you attempt the next one. I would like to conclude the International Conference on Advances in Forensic Science by expressing my gratitude to the esteemed speakers for their profound keynote sessions and technical sessions. Delegates, for your participations and contributions to this conference is very much valuable to us. Let us leave with a renewed commitment to uphold the integrity of our forensic and legal practices, ensuring that truth prevails in every courtroom. Thank you, dear delegates, for joining us. Thank you once again. I remain. Dear delegates who are attending online as well as who are here, a feedback form will be shared in the WhatsApp group. Kindly take 2 minutes of your time to give us your valuable feedback. And certificates will be distributed in the admin block entrance, that is the same block entrance, you will get your certificates.
So good evening, everyone. So I appreciate and want to thank all our resource persons that are there today and also who have come online and have been with us for the past 2 days. A big round of applause to them. Because without that, we won't see what we are seeing today. We won't be happy with what has happened over the past 2-3 days, which has taken obviously months of planning and work that has gone into. And I would like to thank and appreciate the conveners of the conference, Professor Devi and Professor Nandini, for their continuous hard work over the months to ensure that everything is planned as per schedule. And thank you very much, dear teachers. And our faculty members have been there even till late night, ensuring everything is printed, all of these things are ready, backdrops are ready and all of that. But I would like to thank all of the teachers of the Department of Forensic Science for each and everything that they have done in all aspects, because for organizing a conference, it requires different work, right? So all the members of all the faculty members of the Department of Forensic Science, thank you very much for all your hard work. And to support us faculty, we have our students from the Masters of Forensic Science, both first year and second year, who have patiently listened to us and obeyed us and worked with us throughout this conference. I should say that it is not that we have done it by ourselves, but without the students' help, it wouldn't have been very easy for us. Right now, all teachers have been, I think all teachers will agree with me that we have smoothly sailed this conference because of the support that we have from our students. So thank you all, dear students. And I'd like to thank all the, Forensic Science BSc students, second year and third year, who have been on rotation coming and witnessing the lectures and experiencing the talks that are given. So thank you very much for your support in engaging in this conference. And lastly, this conference would not be possible without any external participation. Because your participation continually, I can see some faces that are continually coming and supporting our department and our college with ventures like this. And definitely your presence over here makes this a more grander success. Thank you very much, dear. Certificate. So certificates for external participants will be issued down at the registration desk, guys. But you can go to the staff pantry in the first floor for your high tea, and then casually you can take your certificates from the registration counter. So thank you all very much once again. Thank you.